All right. Good evening, ladies and gentlemen. It is now 6:05 on Monday, November 16th, and we will begin the public speak out portion of our city council meeting. We have 9 people signed up for public speak out. We will give each individual 2 minutes to speak. So if you could please be mindful of your time, it'd be greatly appreciated. And we will begin with Karen Lee. Is there a Karen Lee present? Seeing no Karen Lee, we will move on to Miss Galanek.
Mr. President.
Oh, is she here?
There.
And I'm sorry. Yes,
Muted, though.
Miss Lee, I see you. You need to unmute. Miss Lee, can you hear us?
Yes.
Okay.
I'm sorry. I thought Focus Springfield was unmuting. Apologies.
That's all right.
Okay. My name is Karen Lee, and I'm a Springfield resident, and I live in Ward 6. I'm here tonight to support the Massachusetts Healthcare Trust and to briefly highlight how the current healthcare system impacts family resources at the end of life. One negative impact on the family is the 1993 Medicaid Estate Recovery Act that President Clinton signed into law, and it has contributed to the loss of wealth for working families. We know that owning a home is the #1 way that most families grow wealth, but if that homeowner has the audacity to grow old or sick and needs long-term care, Medicare only pays for a single event for 21 days. After that, if you don't have a separate long-term health care policy, nursing home care costs can range from $3,000 to $10,000 or more per month. If you can't afford that, Medicaid is available to cover the long-term cost, but only after you've spent down all your savings, liquidated your assets, and agreed to a lien on your home. After death, the Medicaid Estate Recovery Act is triggered, and if your estate can't pay for the care you received, your home may be sold to reimburse the state for the long-term care provided. There are some exceptions and waivers to this rule, but in short, the 1993 Act systematically targets working class individuals who manage to build up equity in a home only to then see it wiped out because they get old or sick. It is especially cruel to communities of color who have already faced decades of obstacles to home ownership. The proposed act establishing Medicare for all in Massachusetts will cover long-term care and provide alternatives to nursing home care. Most importantly, it will safeguard a family's assets and ensure that after a lifetime of working, a family is not penalized, but uplifted by any wealth transfer. With COVID-19 still raging and the federal government failing to provide a national plan, gig workers, 1099 employees, and seniors at the end of their life, and families in general, are all feeling the burden of a costly employer-based healthcare system that is handicapping most Americans. There's nothing progressive or conservative about single payer. It is simply cost-effective and the right thing to do, and Massachusetts can do better. I ask for your support of the resolution supporting an act establishing Medicare for all in Massachusetts. Thank you.
Thank you. Next up, we have Barbara Galanek.
Hi, my name's Barbara Galanek. I'm a retired teacher after 25 years. My story's pretty unremarkable. It's even common. And I realize that I am among the fortunate in this country. In 2001, I was diagnosed with multiple sclerosis, which is a chronic, debilitating disease with no cure, but very expensive treatments. According to the manufacturer's website, the list price for the drug I take to control the progress of my disease is $93,295.70 per year. I quote them, "The amount you pay for the drug will largely depend on whether you have insurance, the type of insurance you have, whether your insurance provider considers the medication to be preferred or not preferred, and whether you've met your deductible. This past year, I had a reaction to the medication I was previously taking and had to stop it. I began to show increased symptoms of my MS, but was forced to wait a month and a half before my insurance company decided they would allow me to take a new medication and how much I would pay for it. Why do these bureaucrats decide whether I can take a medication prescribed by a doctor with years of training and experience? I pay monthly bills for Medicare coverage, employers' health and dental insurance, co-pays, deductibles, and prescription drug costs. Last year, I paid $10,285.10 for medical care, which does not include the additional costs the town paid to my insurer. The cost of insurance and the probable need for long-term care in our futures prompted my husband and I to sign our home over to our daughter in order to preserve something from the insurance and pharmaceutical giants. So now I ask you, how much is enough? How many people need to become poor before the voracious greed of these companies is satisfied? I ask you to support the bill too.
Thank you. Can you please state your address for the record?
Yes, I live in Wilbraham.
Can you please state that full address?
Yes, 153 Manchonis Road, Wilbraham, Massachusetts.
Thank you. Ms. Lee, can you do the same for us for the record?
Sure. Karen Lee, 18 Lawn Street in Springfield.
Thank you. The next person up to speak is Gladys Franco, and can you please state your name and address for the record?
Good evening. My name is Gladys Franco, 27 Olmsted Drive, Springfield. I am an educator and I'm a resident of the city, and I believe that our healthcare system is broken and that Medicare for All is the way to fix it. I've paid into various private insurance throughout the years, such as Health New England, Blue Cross Blue Shield, Harvard Pilgrim, and the GIC Commonwealth Indemnity Plan. I'm currently paying more in health insurance than for federal and Massachusetts taxes combined, and this seems outrageous. Over $7,000 plus deductibles and co-pays. This is a substantial amount of money for a mother of two. This is on top of dental insurance and eye insurance. And this is with my employer paying 70% of my health care. They paid over $18,000 for health and dental last year. And by the way, I believe that dental health should be covered under Medicare for All as well. I have friends that avoid necessary procedures and end up having other health problems as a result of not having the money to foot additional bill for the dental procedures. My mother has TUFS Navigator insurance through the city of Springfield, which some say it's better than most, but she still gets billed hundreds or thousands of dollars each year in deductibles and copays or tests and procedures that are not covered under her plan. My brother is currently unemployed, so he doesn't have health insurance. My brother-in-law has to pay out of pocket for any procedure he needs because he's not able to get health insurance. Due to a disability, my sister is lucky enough to have Mass Health, and that is the best insurance she's ever had. There are no issues with getting tests or procedures done. She and her kids have what they need. I have also benefited from Mass Health in the past, and I can honestly say it is the best plan I've ever had. I would rather pay into a system like Medicare for All than continue paying to a private insurance company that does not have my best interest at heart. I would rather pay more in taxes to have a better system for all of us. The current costs of health insurance are too much on individuals, on families, and on our society. Healthcare needs to stop being a money-making business and become a right for all residents. It is also our responsibility that I'm willing to pay for so that we can all have the same benefits and a more equitable healthcare system. I ask that you please support the resolution establishing a Medicare for All in Massachusetts. Thank you.
Thank you. The next person signed up to speak is Christopher Martin. Can you please state your name and address for the record?
Hi there. My name is Christopher Martin. My address is 133 Congress Ave in Holyoke, Massachusetts. I'm a resident of Holyoke that has been involved with Medicare for All movement in the Pioneer Valley for 3 years now. In that time, I've canvassed over 1,000 households in support of this cause and have come to two conclusions. Despite the access provided by MassCare, the people of Hampden County are struggling with medical debt and afflictions directly caused by them avoiding further debt. And the people of Hampden County overwhelmingly support a universal health care program. Although our current crisis has limited my work to Zoom meetings such as these, the ongoing pandemic that we all struggle under has emphasized to me exactly why this is so important. millions of Americans are losing their jobs and in turn are losing their access to their health care at a time when medical access has never been more important. Not just for the now unemployed, but for everyone that they may come into contact with. With all that in mind, it comes as no surprise that my apologies. With all in mind, it comes as no surprise that the canvassing efforts that I participated with as part of Western Mass Medicare for All found that in over a dozen towns and cities up and down the valley, the vast majority of citizens are in support of this measure and wish for those that represent them to support a statewide universal healthcare program as well. In Holyoke, where I did the majority of my canvassing, our findings found that 67% of citizens voted in support of such a bill. And we were able to easily then receive support from the state representative, city council, as well as the mayor. I strongly urge you to also come out and support for this, for the massively popular common good, as well as a program that will make future crises, such as the one we're currently in, much less precarious for your constituency. Thank you.
Thank you. Next up, we have John Wright and Betty Wright. Can you please state your name and address for the record, and you have to unmute yourself.
Greetings, members of the Springfield City Council. Thank you for setting up to speak out on this important issue. My name's Betty Wright, and I'm a Springfield resident, and I'm a retired nurse practitioner. I worked for Bay State Medical Center in Mason Square early in my career and later at Tapestry Health in Springfield. I support Medicare for All as it is outlined in the bills currently under consideration in Massachusetts House and Senate. One of the main reasons I support the bill is that in my work experience with patients over the years, I found that the folks with no insurance were the ones less likely to be involved with the healthcare system, where there are regular periodic checkups with screening, history taking, assessment, counseling. That's what we call health maintenance. And often uninsured folks postpone a visit until something that could have been treated early has become more serious, life-threatening or contagious, needing more invasive treatment. When, of course, all of this, the more invasive treatment is generally costs more. My understanding is that with Medicare for All or a universal health care system, like they have in most other developed countries, these unnecessary and sometimes tragic outcomes can be avoided. Everyone can be healthier in general if they have health insurance coverage. So thank you all, and I wish you, happy holidays. My husband will go next. John?
Thank you.
Yeah, if you don't mind, Council President, we were told by Mrs. Kakionakis that we could both be ganged into the same
You absolutely can.
slot. Okay, thanks very much.
Can you please state your full address for the record?
Yeah, so that mine and also the previous speaker, Betty, we're at 175 Garvey Drive in Springfield.
Thank you.
And we're in Ward 5. Okay, so I have it on my beginning here. Where does it go? Anyway, I should also point out that I'm a member of Western Mass Medicare for All, and that it's a group, grassroots organization that seeks to based on the proposition that healthcare is a human right. And at this time, we're seeking to promote the passage of the bills before the Massachusetts House and Senate, and encourage the passage of the resolution that is before you tonight. My perspective is from having been employed in healthcare for virtually my whole adult life. I started out at Holyoke Hospital, then went to Western Memorial Hospital, and finally Bay State Medical Center. At first, I was a respiratory therapist, caring for patients in critical care, often intubated and on ventilators. This is what we've come to know these days as the front line. I became aware that many of these extremely sick patients had been unable to afford health insurance. And those that did have health insurance did not generally seek preventive medical treatment, avoided it because of what would turn out to be high out-of-pocket costs, even though they were insured to a certain extent. More recently, I transferred into the biomedical engineering department, maintaining the ventilators and whatnot that I used to operate in the treatment of patients in respiratory failure. I continue to hear from my former colleagues, the nurses and the respiratory therapists, about the difficulties posed by the increased numbers of very sick patients, especially during this time. I've also maintained contact with other hospital employees, for instance, those charged with the billing and the wrangling with the insurance companies, and have been impressed with what a waste of time this all has been, and how record keeping under a universal payer system would require a fraction of the work. I'll finish and thank you very much for your consideration of this important initiative.
Thank you. Next up to speak is Pat Healy. Do we have a Pat Healy present? Okay, seeing none. Next up is Jeff Jones.
Hello.
Can you please state your name and address for the record?
Sure. Jeff Jones, 76 Woods Road in Northampton. I'm currently the president of the Western Massachusetts Area Labor Federation, which is based in Springfield. I'm also the recently elected president of UFCW Local 1459, also with offices based in Springfield. And I'm here to talk about the same thing as the previous speakers, the Medicare for All in Massachusetts. Pre-pandemic, there were already tens of millions of people who had no health insurance and had medical debt they could never pay off. And now with the pandemic, we're seeing that millions of more have lost insurance along with their job. In many respects, we're progressing on the road to what in other parts of the world are called failed states with regard to health insurance. Wealth should not buy health, and color should not buy illness. Whether we're white, black, or brown, none of us is safe when any of us is living paycheck to paycheck without insurance, and you can't afford to take time off when sick. And upon losing your job, you therefore lose your insurance. And that's the way it's set up right now. This moment calls on all of us to take bold action to envision a fundamentally different society built on a healthy populace. We need to expand affordable health care, not eliminate it. Statewide, this moment calls on us to deepen the fight to pass the act establishing Medicare for All in Massachusetts, which would establish a statewide single-payer healthcare system that would guarantee equitable and quality healthcare access for all Massachusetts residents. Passing this resolution sends a strong signal to our legislators that there is broad support for a statewide single-payer system and help build the pressure we need to get this legislation passed. And thank you for your time.
Thank you. And our final speaker this evening is Ms. Sonia Watson. Can you please state your name and address for the record?
Good evening to each and everyone. Good evening to especially my City Councilman, Marcus Williams. My name is Sonia Watson. I'm a resident of 16 Acre of Ward 5. Thank you for allowing me this time. I am here on my own tonight, and I am also an educator within the city of Springfield. I love Springfield. Some people can't say that, but I can say it. I love my city and my city. Okay? And as citizens, we all have to do our part. But there's one thing that has been on my heart lately, and it's how do we leave a legacy for the next generation? For the younger generation, what type of Springfield are we leaving them? I know that Springfield, as I journey throughout my day, it seems as though there's a development on every corner. Springfield has become a cash cow for developers. Some of those developers, most of them are not residents of Springfield. I am not against growth. Growth is important. It provides money for the city. However, I am asking my city council men and women to just think about the fact that we need to leave a little bit of, if I would say, vegetation, green, for the next generation. What it does, it provides, it helps to clean the air. And there's a big talk on global warming. So we need to preserve whatever we can for the next generation in Springfield of greenage. Where I live, it's beautiful. And I recall people coming and said they did not know that there's places like this in Springfield. Springfield is a beautiful place. All I'm asking is that give Springfield a chance. Let not out-of-town developers come in and take up every area of woodland that we have in Springfield. The children are counting on you. Springfield has been noted for data, has proven it. We have the highest asthmatic children. The green that we have in Springfield, the green woods, helps to purify the air for the next generation. I see those asthmatic children. I work with them every day. Thank you for your time.
Thank you, Ms. Watson, and I apologize. We have Jay Latore who will conclude our public speak out. Sorry about that, Jay. Can you please state your name and address for the record?
That's okay, Mr. President. Juan Latore, 122 Forest Hills Road in Springfield. Can you hear me okay?
Yes.
Great, thank you. Good evening, councilors. I come before the City Council this evening to voice my opposition to the proposed amendment to the City Charter, Chapter C, Section 44D. This is in regards to the position of candidates within the municipal ballot. It's item 20 on your agenda tonight. As you know, incumbents seeking re-election to elected office enjoy a note on the ballot indicating that they are seeking re-election. This is written in the Mass General Law, and I feel most Americans agree with this approach. I'm in opposition to codify a process that allows the incumbents to be listed on the ballot ahead of challengers in seeking a city council at large seat, which this proposal before you tonight specifically mentions. I understand that previous ballots have listed incumbents above challengers on the ballot. This policy, in my reading, deviates from the charter. The existing section makes no reference to incumbents being listed above challengers. The existing language states that the names should be listed, quote, in their order as drawn by the clerk, end quote. The proposed amendment references MGL Chapter 53, Section 34, which does provide a process by which candidates can be listed on a ballot. However, the section includes language that states, and I quote again, except where city charters provide otherwise, end quote, which suggests to me that the city council can establish a more impartial process. We just participated in an election that resulted in 54% voter turnout in Springfield, which is fantastic. We need to build on that momentum by continuing to encourage involvement in civic life. The more candidates that step up to run, the more friends and family get involved, and the more engaged our community becomes. A random drawing is a more impartial way to do this and will encourage more residents to participate in future elections. So I ask that the City Council reject the amendment as written and continue to work on a more impartial process. Thank you, Mr. President.
Thank you. And that concludes the public speak out portion of our meeting. We will rest until 6:30, at which time we will start the regular meeting of the City Council. Thank you, everyone who spoke out this evening.
Thank you, Mr. President.
All right, good evening, ladies and gentlemen. Welcome to the regular City Council meeting. It is now Monday, November 16th. It is 6:30 on Monday, November 16th. Madam Clerk, can you please call the roll?
Counselor Gomez.
Present.
Present. Counselor Whitfield.
Present.
Present. Counselor Davila. Counselor Davila. Absent. Counselor Fenton.
Present.
Present. Counselor Curran.
Present.
Present. Counselor Ramos.
Present.
Present. Counselor Walsh. Absent. Counselor Williams.
Present.
Present. Counselor Allen.
Present.
Present. Counselor Letterman.
Present.
Present. Counselor Edwards.
Present.
Present. Counselor Brown.
Present.
Present. Counselor Hurst.
Present. Can you please see if Counselor Davila is present at this moment?
Counselor Davila.
Thank you. Will the council and their guests please rise for a moment of silence? Will you please remain standing for the Pledge of Allegiance?
I pledge.
I pledge of allegiance to the flag of the United States of America and to the republic
For which it stands. One
one
nation.
nation, under God, indivisible, with liberty and justice for all. Are there any reports of committee? Councilor Ramos.
Yes, Mr. President, good evening. I have a report of committee from the Public Safety Subcommittee. At the last regular meeting, there was one item that was referred to my committee. It was the discussion on collective bargaining agreement for the Springfield Police Department Supervisors Bargaining Unit. We held two committee meetings. The last one was this past Thursday, in which there were some councilors present. I don't have the attendance in front of me. There were several councilors who were present at that meeting. We had further discussions on this proposal. No new information was brought to the table, but councilors were given an opportunity to ask questions, and it was hopefully something that will reduce the number of questions and discussion that is going to be taking place tonight, as I intend to bring it out of committee. One of the things that was brought up at the first meeting was, two concerns that were brought up were, one being the time, the time limit on when complaints can be brought up against officers or supervisors in this unit, and there were some concerns about the training assessment and how much that should count towards promotion. So those questions were asked and answered in committee. We were also made aware that the Springfield Police Department is the only, the language that is in this contract is unique to our city, and in the form that it's written is we're the only municipality in the Commonwealth with this exact language in the contract. So no vote was taken in committee, and it is my intention to bring it out for discussion and for a vote this evening.
Sorry, thank you, Councilor Ramos. Are there any other reports of committee? Councilor Whitfield.
Thank you, Mr. President. Today at 5 o'clock, we held a Finance Committee meeting, and I want to thank yourself and Councilors Davila and Councilor Gomez for joining, and I want to especially thank Councilor Tim Allen for running the meeting, as I was having some technical difficulties today. Thank you, Councilor Allen, for stepping up and doing that. We went over the financial orders that we will discuss later today, and most importantly, well, they're all important, but we went over the COVID funding that we received, and we'll go over all of the financial items in today's meeting. And so I'm not going to regurgitate all that information because we're going to listen to it shortly. So thank you, Mr. President.
Thank you. Are there any other reports of committee? Seeing none, Councilor Letterman.
Mr. Chairman, I don't have a report of committee, but I do have a request to place before the body, if our colleagues might indulge me. We do have 2 resolutions on this evening, and I know we do often take resolutions last. However, in this case, we do have a member of the General Court, State Representative Lindsay Sabadosa, here to testify on one of them, as well as a former Obama cabinet member, Dr. Don Berwick, former administrator of the Centers for Medicare and Medicaid. And so I'm wondering if our colleagues might be willing just this evening to take items 22 and 23 out of order, so we might dispose of them so that our testifants may move on with their schedules.
Thank you. Madam Clerk, if we could please call the roll on accepting the reports of committee, and then we'll entertain Councilor Letterman's request, please. And can you also please see if Councilor Davila is present at this time?
Councilor Davila?
Okay.
Do you see him on your screen, Counselor?
I do not, but I know he was at our
Okay.
last subcommittee meeting, so I assume he'll be joining us shortly, so I apologize. Madam Clerk, can you please call the roll on accepting the reports of committee?
On accepting the reports of committee, Counselor Gomez?
Yep. Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila? Absent. Counselor Fenton?
Yes.
Yes. Counselor Karen?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh? Absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes. Madam Clerk, can you please call item number 22 out of order if there are no objections from the council, followed by item.
I object.
Councilor Allen has objected. It will remain where it is at. Madam Clerk, before we get to item number 1, I know we are joined by Commissioner Helen Colton Harris.
Point of order, Mr. Chairman. Does Councilor Allen object to both items being called out of order or just item 22?
Good point.
All right, well, thanks.
Thank you. Thank you, Councilor Letterman. My apologies. Should have asked that. So we are joined by Commissioner Helen Colton Harris, and I wanted the commissioner to just give councilors, from an informational standpoint, a brief update as to where we are at with the COVID-19 pandemic. I know she just gave a recent report this morning, but I was hopeful if she could surmise that report briefly for the councilors and for those viewing at home. So Commissioner Colton Harris, if you are present, the floor is yours at this time.
Thank you very much, councilors. I will be brief and I will give an update. Do I have the ability to share the screen?
If not,
Yes.
we will get you that ability. Yes.
You can, yes.
Well, it's not. Just one second. One of my children is getting ready to help me. Go ahead. Where do I hit share screen?
I think we see your screen, Commissioner. Has Zoom on it.
Right. It does not appear that I'm going to be able to share at this point. And so I'm just going to move forward with oh, she's telling me I'm sharing already.
You are.
Okay.
If you want to minimize the Zoom and.
Okay. Mute is not here. That's all right. I'll just go ahead and do it verbally without the data. Counselors, I will send you the update I was going to give. I am not able to share my screen at this point. So let me start. My daughter's telling me I'm already sharing my screen. I just can't get onto my desktop for whatever the reason. So let me update you. So at the update this morning, I said that the house is on fire. And I think when you hear the data, you will understand what I meant. The statewide positivity rates are 182,544. Statewide on Friday, there were 2,482 cases. Saturday, 2,674 cases. Sunday, 2,076 cases. And so it's important just to recognize that the house is on fire across the Commonwealth. We are seeing the rates that are really growing in the Commonwealth and in the city of Springfield. On Monday of last week, there were 86 cases. Tuesday, 34 cases. Wednesday, 115 cases. Thursday, 116 cases. Friday, 128 cases. Saturday, 137. And then on Sunday, there were 62 cases. Today, I just got the report. There are 103 cases in our city. So last week, there were 646 cases in the city of Springfield. Also, the municipality, and what that means is that on October 26, there were 313 cases that week. The next week, there were 437 cases, which is a 28.5% increase. Also, on November the 9th, we saw 646 cases, which is a 32.5 increase from the week before. If I was able to share the screen, you would see that in every zip code in the city of Springfield, the cases have gone up. The cases that we're seeing right now are really concentrated across the city, although the numbers are different. For example, in 01104 last week, there were 122 cases. 01108 had 135 cases. 01109, 136 cases. And so together, just those three zip codes represent 60.4% of the cases in the city of Springfield. It is really pervasive and across the city. The confirmed cases in weekly47% are concerned, 47% are 30 years and under, 47% are 30 years and under, 31 to 50 is 30%, and then 51 and older is 23%. As you're watching the hospitalizations increase, I can tell you that that 51 and older age group is the age group for the most part that we are seeing in our hospitalizations, and that's why those numbers are increasing. The race breakdown in the city of Springfield, and this I'm only talking about last week. White was 27%, Latinx 28%, Black African American 14%. Again, that was just last week. The unknown percentages is 29%. And so as you can see, all races are impacted in the city. And so we really need, as a city, to be able to think about how we are going to behave as far as our behavior is concerned. So I'm asking you as elected officials, as I give that brief update again, I do have a full presentation. I will make sure that it is sent to each one of you so you can visually see what we're dealing with in the city. Over 60% of our cases, as I said, is under the age of 40, which means we have a lot of younger individuals in our city who are not behaving in a way that is responsible, I would say, as far as face covering, hand washing, and social distancing. But this just isn't the city of Springfield. If you're watching the news, it is across the nation. So, and thinking about Thanksgiving, which I think is very important because it's right around the corner. We saw after each holiday that we had an increase in cases. I expect that that will potentially happen as we look at Thanksgiving coming up. And so what I am recommending is that you and I and our residents stay with their immediate household in your own bubble, your own pandemic bubble. That is the individuals that you are around in your family, whether that's 10 or 15, but that you have been around, who you have at least have some knowledge of their behavior. But if you must host a Thanksgiving gathering, we're asking that you host a household celebration, or you gather virtually. It's important that you evaluate the risk. Who is in your family? The elders, all ages, evaluate the risk. If you have someone in your living home that is at great risk for contracting COVID, you should reconsider hosting your gathering. Limit the number of individuals who are attending. Governor Baker has said that 10 should be our indoor numbers. I would agree that that's really important to keep a low number. For outdoors, it's cold out, so outdoors may not be what you and your family can do, but it's important to think about an outdoor gathering if you can do that. Increase ventilation, open the windows if you can. That would increase the airflow, which really will help if you are indoors. Discourage direct contact and encourage hand washing. I know in my family, when we get together, we want to hug, we want to do all of the things that make us physically feel as if we're a part of each other. We are asking that you do not, or think about not doing that, because obviously you can spread the virus that way. And then limit the sharing of utensils if you can. It's a very difficult time, and I'll just say one more thing. Emotionally, we are all raw. The hospital workers that we're seeing are going through the second surge, and they've been through the first surge, but it's emotionally, we're drained, many of us. And so I would ask that the holidays are coming. There's holiday depression. There's COVID depression. There is depression related to our lives and how we're living at this point. So I would ask individuals to think about that. If you see family members who are emotionally drained, who are exhibiting behaviors that's different, I would ask that you please think about talking with them, getting help for them if you can, because all of us are really feeling with this pandemic and this second wave that we are struggling as a society, and certainly in the city of Springfield. Again, I'm sorry that I was not able to share my screen to show you the data as I wanted to, but I will make sure that you get the information.
Thank you, Commissioner, for that update. We are not entertaining questions at this time. I know I've had a number of conversations with Councilor Edwards, and he in the future will hold a subcommittee meeting, at which time hopefully the commissioner can share whatever it is that you had for us today, Commissioner, and then speak about that, and hopefully have an opportunity to answer some of the questions. For those individuals on the council who were concerned as to whether we, or had questions as to whether we were going to go back in person anytime soon, I can assure you that we are not going back prior to January, as we are in the red. I've had a conversation with the commissioner as well as Pat Sullivan in conjunction with our solicitor. And I think the general consensus was that until we get out the red, that conversation really should not occur, and the likelihood of us going back while we are in the red is not going to happen. And so I think whoever is the next president of this council ought to start thinking about that as over the next month or so as to how it is that they want to return. They are prepared to do a hybrid model, which we also discussed, in which we would sort of have, or not sort of, we would have half of the counselors at home, and then the other half would be in the chambers, and we would go every other seat. But we can have further discussion about that in the future. And thank you so much, Commissioner, for that update. Madam Clerk, will you please call the first item on the agenda?
The first item on the agenda is the September revenue versus expenditure report.
Madam Clerk, can you please recognize Councilor Davila?
Counselor Davila?
Present.
Present.
Thank you. Is there anyone present to speak to item number 1? Can you please state your name and address for the record?
Thank you, Mr. President. Patrick Burns, 90 Clement Street, Springfield. Tonight you have the September revenue and expenditure report. As I pointed out in the Finance Subcommittee meeting this afternoon or this evening, the net school spending shortfall amount has been appropriated in the school budget. So you'll notice that the budget has grown by approximately $14.8 million. This is the amount of money that was left over in the school budget that, pursuant to Chapter 70, must be appropriated in the current year budget.
Thank you. Are there any questions or comments from the council for Mr. Burns? Seeing none, Madam Clerk, can you please call the roll on accepting this report?
On accepting the report, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton? Absent. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh? Absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes, the report is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is for a special permit at 441, 445 Armory Street.
Thank you, Madam Clerk. I do believe I saw an email related to this item. Is this still, thank you, Phil, if you could please state your name and address for the record.
Yeah, Phil Dromey, Deputy Director of the Office of Planning and Economic Development. I received an email from the petitioner this morning, and I was just looking for it in my email. It just says, hi, Phil, I am sorry to inform you that I will not proceed with the application. I came to a disagreement with the landlord over the lease. So he did not specifically request to withdraw, but I guess that would be my recommendation, is that the city council just withdraw, because it does not appear that he is moving forward with the application.
Thank you, Mr. Dromey. Can we have a motion by a councilor to withdraw this item if there are no questions or comments for Mr. Dromey?
Mr. President, I move that we allow the applicant to withdraw the item without prejudice.
Thank you. Thank you, Councilor Fenton. A motion is made by Councilor Fenton, seconded by? Seconded by Councilor Gomez. Madam Clerk, can you please call the roll on withdrawing this item?
On withdrawing the item, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yes.
Yes. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes, this item will be withdrawn. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is for a special permit for motor vehicle repairs and sales at 1026 Bay Street.
Thank you, Madam Clerk. I just want to remind councilors that we've had extensive discussion regarding this item. Hopefully we can avoid being redundant and only ask questions that we haven't asked at our previous meeting. Madam Clerk, is there any testimony rebutting this special permit?
No, we didn't receive any testimony.
Thank you. Are there any questions or comments from the council of the petitioner? Seeing none, that closes this portion of the hearing. Is there any discussion among the council regarding this special permit? Seeing none, Madam Clerk, can you please call the roll on approving this special permit?
On approving this special permit for 1026 Bay Street, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes. Councilor Gomez, can you please read the reasons into the record?
I gotta find them. You gotta give me a second. I wasn't sent them today, so I apologize. Hold on for a second.
I apologize. I did ask that happened. If anyone has the reasons handy and
I
can
have
send
the
them,
reasons
you
handy,
do.
Councilor. I do, but they're handwritten. I don't have them typed up.
Can you take a picture and send it to Councilor Gomez, please?
I can just excuse my handwriting, Councilor.
I apologize for the delay.
I'm still actively looking for them because I know they were sent to me through an email, and I have so many emails that I'm going through. I apologize.
I sent them to your cell phone, Councilor, if you can read my handwriting.
I'm going to attempt. Okay. This site is in a specific appropriate location for such use, structure, or condition. The use of this
The use as developed will not
okay,
adversely.
I got you. Use as developed will not adversely affect the neighborhood. Adequate and appreciate facilities will be provided to the proper operation of the proposed use. Yeah, number 4, you got me.
And incorporating the planning
Okay,
staff analysis.
Incorporating the planning staff analysis of the basis for the findings.
That's it.
And that's it.
Thank you, Councilor Gomez. Madam Clerk, can you please call the roll on accepting the reasons?
On accepting the reasons, Councilor Gomez?
Yes.
Yes. Councilor Whitfield?
Yes.
Yes. Councilor Davila?
Yes.
Yes. Councilor Fenton?
Yes.
Yes. Councilor Curran?
Yes.
Yes. Councilor Ramos?
Yes.
Yes. Councilor Walsh absent. Councilor Williams?
Yes.
Yes. Councilor Allen?
Yes.
Yes. Councilor Letterman?
Yes.
Yes. Councilor Edwards?
Yes.
Yes. Councilor Brown?
Yes.
Yes. Councilor Hurst?
Yes, the special permit is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is for special permit for motor vehicle repairs and sales at 1300 Worcester Street.
Thank you, Madam Clerk. Is there any testimony rebutting this special permit that we've received?
Yes, we received 2 emails.
Thank you. Can you please read them into the record for us?
The first is Mr. D'Souza, owner of 1312, 1314 Worcester Street. Only concern is on-street parking. I and my tenants many times have no parking space in front of my building for tenants and visitors due to existing car repair garage across the street. Vehicle lot should have enough off-street parking. Thanks. And the second email, my name is, I apologize if I butcher this name, Adelaide Bobowitz, I am the owner of 1294-1296 Worcester Street of the residential building. I am writing to notify the public hearing mail was received late past beyond the date of the hearing itself. My only concern with this proposal is that my property address be not associated with this business for legal confusion in the future. Also, there be no pollution of hazard waste material from the vehicles that could go into the drinking supply of the city, and also noise.
Thank you, Madam Clerk. Mr. Dromey, can we just speak to the first point regarding the address and the confusion with the address? Has that been rectified?
I believe so. Originally, that house was part of that larger parcel, and that the house was carved off due to an A&R plan, which is just a reconfiguration of the property line. So I believe that has been addressed through the assessor's office once they get notification of the change. So I believe that the first one should not be an issue.
Thank you. Are there any questions or comments from the council regarding any of the testimony received for the petitioner? Councilor Ramos.
Thank you, Mr. President. I think we were, one of the things that we decided at the last hearings meeting, was that we would allow the planning department to revisit the issue with the parking and their recommendations to limit the number of parking spaces. Do we have an update on that?
Thank you. Mr. Dromey?
Yeah, Mr. Lumsden did send a revised plan. I emailed that to the city council last week. I was looking forward to my email, but I don't have it. It does show, although it's tight, but he was able to show that he could get the 27 parking spaces, 27 display area location on the site, as well as I believe 2 customer parking and 2 employee parking as well, as he did submit a plan also to show that he's got additional parking on his adjacent lot at I think it's 1300 Worcester Street. But so I was satisfied. I mean, again, I think it's going to be tight, but it does, the plan that was submitted did show that he's able to get the cars in.
Thank you.
Thank you. Are there any questions or comments for the petitioner? Seeing none, we will close that portion of the hearing. Is there any discussion amongst the council? Councilor Davila, did I miss you on the first question?
No, I suppose I could ask now, Mr. President. Phil, you might be able to answer this, but I do recall that we were talking about not only the amount of parking spaces from going from 27 to 20, but also if there's going to be any work done on the premises itself. And I do vaguely recall saying that he was going to work on 2 or 3 bays. Is that correct?
I defer to Mr. Lumsden, but the special permit is for motor vehicle repairs, so he will be doing repairs at this location.
He will be doing both. He will be doing the repairs and the car sales.
Right, I believe so. I know Mr. Lumsden's here tonight.
Is Mr. President? Is he present?
He is.
Mr. Lumsden?
Yes, I am.
Can you please state your name and address for the record?
Garrett Lumsden at 107 Oak Street, Indian Orchard.
Thank you.
Good evening, Mr. Lumsden. So I was just wondering, can you give us an update where you are with the situation with the parking going from, if I recall correctly, 27 to 20, and the amount of cars you're going to be working on at one time on the property?
Yes, sir. So the display for the cars is actually in Worcester Street, but the repair shop, the shop actually go all the way to Pinevale Street. So the repair shop would be, the entry for that repair shop would be on Pinevale Street. So it's pretty much 2 different locations. So we wouldn't be entering from where the cars are parked for display. We'll be entering from the back of the property.
So are they going to have 2 different addresses?
No, it's the same address, but it's rear Worcester Street, which rear Worcester Street, which the repair shop is on Pinevale.
Okay.
The corner of Pinevale.
Right. So in terms of the amount of cars you're going to have there, is it going to be 27 or 20?
It's 27.
You're going to have 27. And yes. How many cars are going to be working at one given time on the site?
2 cars. We have 2 bays at the back.
Categories. Okay, Mr. President, if I may, I would love to yield the remainder to hear if, without objection, to Councilor Ramos' thoughts on the amount of cars on the property.
I'll defer to Councilor Ramos if he wants to say anything.
Yes, if he does. If not, I yield.
Councilor Ramos, did you have anything additional that you wanted to add regarding the cars?
No, Mr. President, I'm satisfied with Phil's. I'm satisfied with Phil's answer. I left it up to the planning department to decide whether or not that was they had enough space, and I'm satisfied with his answer.
All right, thank you, Mr. President.
Thank you, Councilor Ramos. Thank you, Councilor Davila. If there are no further questions for the petitioner, that closes this portion of the hearing. Are there any questions or debates amongst the council? Seeing none, Madam Clerk, can you please call the roll on approving this special permit?
On approving the special permit for 1300 Worcester Street, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes. Councilor Gomez, can you please read the reasons into the record?
Reasons for a granted permit. The specific site is an appropriate location for such a use, structure, and condition. The use as developed will not adversely affect the neighborhood. Adequate and appropriate facilities will be provided for the proper operation of this proposed use. To incorporate the planning staff analysis and the decision at the basis of its findings. Congratulations.
Thank you so much.
Thank you, Councilor Gomez. Madam Clerk, can you please call the roll on approving the reasons?
On approving the reasons, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes, the special permit is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is a zone change at Northside Boston Road from Business A and B to Residence A.
Thank you, Madam Clerk. Have you received any testimony in opposition to the zone change?
We have not.
Thank you. Are there any questions or comments from the council for the petitioner? Seeing none, that closes this portion of the hearing. Is there any debate amongst the council? Seeing none, Madam Clerk, can you please call the roll on approving the zone change?
On approving the zone change, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes, the zone change is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is a zone change at 1245 Liberty Street.
Thank you, Madam Clerk. Have we received any testimony in opposition to the zone change?
We have not.
Seeing none, are there any questions or comments from the council for the petitioner regarding the zone change? Seeing none, that closes this portion of the hearing. Is there any discussion amongst the council? Seeing none, Madam Clerk, can you please call the roll on approving the zone change?
On approving the zone change, Councilor Gomez.
Yes.
Yes. Counselor Whitfield.
Yes.
Yes. Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Curran.
Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes, the zone change is approved. Madam Clerk, can you please call items 7 and 8 together?
Item 7 is a Comcast petition for 151 Chestnut Street, and item 8 is a Comcast petition for Cass Street.
Is there anyone present to speak to these petitions?
Good evening, councilors. Chris Signoli, DPW Director. The two petitions in front of you are both from Comcast. The first one, which is labeled 151 Chestnut Street, is actually work that's being done on excuse me, Worthington for the facility at 151 Chestnut Street, installation of 286 feet of 4-inch conduit. And the second application is an extension, a new line, fiber optic and coax cable to service a facility at 285 Liberty Street. And it will be running down Cass Street from one pole through a vault to the site.
Thank you. Are there any questions from the council regarding item number 7?
Yes, I have a question.
Councilor Gomez, the floor is yours.
Thank you. My question, Chris, how you doing? Good evening. The one on Chestnut Street that you were just alluding to, and then I got a question about Cass Street. The one on Chestnut Street, I did get, that's the McIntosh building, in front of the McIntosh building, right?
It is actually running in the sidewalk in the area where the blast zone was.
Right. Okay. So I did get some constituents that reached out to me that live in that building, and I guess they had some concerns on parking or anything like that. Is any of that work gonna close down any of that parking that's kind of in that vicinity of that area?
No, the parking that is parking lot that's between Worthington and what is that? I think it's Winter Street. In that area has multiple entrances. So only, when they're working in the sidewalk and putting in the new work might a gate be closed, but the other side of it will be open at all times.
All right, Mr. President, I'm just going to yield in case anybody else had another question before I jump into the next question on the next item.
Thank you, Councilor Gomez. Are there any other questions from the council regarding item number 7? Seeing none, Councilor Gomez, the floor is yours regarding item number 8.
Thank you, Mr. President. The proposed Comcast work that's going on Cass Street, is that Cass Street on the side of where 281 Franklin Street is? Didn't we just pave that street over?
Yes, and all the work's being done in the sidewalk. It's actually being done on the where it connects into Liberty Street and on the western side of the street. Oh, excuse me. Yes, western side of the street. So it's not going to be disturbing any of the new paving that's going on out there.
All right. No, I just wanted to make sure because I know we had that moratorium, and that's why I asked that question.
Absolutely.
We had just did that whole street all over, and
yes, we did.
All right, no problem. Obviously, that's where my place of employment is. So I was just trying to see if we're going to get disturbed from because it's a one-way going in and out.
Yep.
So,
absolutely.
No problem. Thank you so much.
Thank you, Councilor Gomez. Are there any other questions regarding item number 8? Seeing none, Madam Clerk, can you please call the roll on accepting both petitions, petition 7 and 8, please?
On accepting both petition 7 and 8, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yes.
Yes. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes, the petitions are approved. And I neglected to mention that I did receive correspondence from Councilor Walsh, who was feeling under the weather this evening. Madam Clerk, can you please call items 9 through 13?
Items 9 through 13. 9 is the Coronavirus Relief Fund, second award, in the amount of $7,171,988. Number 10 is the DOER grant acceptance for facilities in the amount of $200,000. Number 11 is the DPW recycling dividends program in the amount of $71,500. Number 12 is the order approving a gift of $12,000. Number 13 is FY21 Let's Reengage grant in the amount of $5,000.
Thank you, Madam Clerk. Is there anyone present to speak to item number 9?
Yes, Melanie Jacoby, City's Grants Director.
Thank you. Can you please state your address for the record?
Sorry, 417 Plumtree Road, Springfield.
Thank you. The floor is yours.
So this is the second half of there were 2 rounds that were available for the CARES funding that was from the CARES Act. It was given to all states, and then states essentially had the choice of whether or not they wanted to distribute those funds to the municipalities, and Massachusetts chose to do so. And so they did it in 2 rounds. The first round, City Council accepted in the summer was around $6 million. And so we were eligible for a total of about $13 million. So this second round that we were awarded funds is the second half. That would be the full allocation that we were eligible to apply for. And essentially what these funds will be utilized for are COVID-related expenses that FEMA will not cover. We submitted already 2 applications to FEMA Public Assistance Program, but because of the large volume of applications that they've received, we're still waiting for review on those. And so the CARES Fund covering for all the expenses that the FEMA grant will not cover, and it will also cover for 25% of the match that FEMA requires the city to pay for, rather than the city using general fund money to do the match. We could utilize CARES Fund for that.
Thank you. Are there any questions regarding this grant? Seeing none. Did I see a hand up? Councilor Whitfield.
Thank you, Mr. President. Melanie, I don't know if you can answer this, or Lindsay, and I meant to ask it earlier at the finance meeting when we were going over the revenue versus expenditure report. I wanted to know if some of the expenses that I think we're over by 4 million from revenue and expenses. Do some of those expenses can they be redistributed to the CARES Act funding to free up general fund money?
Great. Yeah, that's a great question, Counselor. And I saw that you wanted to discuss that tomorrow, and we definitely will. As of right now, we have no COVID costs on the general fund. So we have isolated all COVID expenses on a separate fund. And once we get funding for those COVID costs, we're kind of strategically figuring out which grant is the best to put it against. So as of now, any of the spending that you see in the general fund is not COVID related.
Okay, thank you.
Thank you, Councilor Whitfield. Are there any other questions or comments regarding this grant? Councilor Williams.
Thank you, Mr. President. Can someone just answer in regards to the indirect costs? I see that indirect costs are not going to be contributed to this round. Can you just speak to the costs that will incur then?
Regarding the indirect for COVID ones?
Yes.
That's a great question. We do have an indirect cost study that was done and completed, but obviously that does not encompass COVID related expenses. So I don't have an answer for that. And unfortunately, CARES will not cover for those expenditures, as you're aware. They're very specific with the type of categories that they will and will not cover. So it is a great question. I do not have the answer for that.
All right, Melanie, and just one more follow-up to that. In the previous round, do you know if that was the same thing or did it differ?
That it's not an eligible cost. Yes, it was not eligible at all.
All right, gotcha. Thank you.
Correct, it never was. Yep.
Thank you, Councilor Williams. If there are no further questions or comments from the council, we will move on to the next item. Is there anyone present to speak to item number 10?
Yes, I am Patrick Sullivan, 17 Arvesta Street, Springfield, Mass. This is a DOER grant, Greens Community Grant. It will replace the existing 1960 boiler at Allen Street. The Allen Street facility has been critical, one for our trade staff who have been doing repairs through the COVID crisis, as well as the school's IT department, which is serving our school children in remote learning. And also the site serves for one of our major warehouses for the city for supplies and materials. It will also take one of the last oil burner boilers offline, converting it to natural gas. So we'll be one step closer to improving our carbon footprint in the city.
Thank you. Are there any questions or comments regarding this grant? Seeing none. Is there anyone present to speak to item number 11?
I am Councilor Chris Signoli, DPW Director. Every year, the Department of Environmental Protection puts out money for the Recycling Dividends Program, the RDP, and based upon the way that we run our recycling program and bulk program, household hazardous waste, et cetera, in the city, you receive points. And based upon the point system that the city received, we received $71,500 this year. Over the last 5 or 6 years, we've received between $60,000 and probably $80,000 every year. So this is a pot of money we become used to receiving from the DEP. Most of this money will be used to purchase new recycling barrels.
Thank you. Are there any questions or comments regarding this grant from the council? Seeing none. Madam Clerk, can you please call the roll on approving grants 9 through 13?
On approving the grants, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yes.
Yes. Counselor
Yes.
Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes. The grants are approved. Madam Clerk, can you please call items number 14 through 18?
Item 14 is a budget transfer within a department in the amount of $14,400. Item 15 is a bill of prior year for Thomas J. O'Connor Center, $88.26. Number 16 is an order approving a contract over 3 years for lease purchase for the IT department. Number 17 is an order authorizing the mayor to execute a quitclaim deed at Southside Green Street. And number 18 is authorization of execution of a quitclaim deed for Eastside Hayden Avenue.
Thank you, Madam Clerk. So I know we've been trying to get around suspending Rule 19 on every order. And so what I think I've been able to think through that may be effective is that we're going to vote on each order. And if each order is approved then we will in turn at the very end suspend Rule 19 for all of the orders at one time in one vote. If anyone objects to that and has an issue with one of the items because they want to see it done in 2 steps or because it goes to committee, then we will exclude that item and take one vote to suspend Rule 19 on the ones that it looks like folks are going to approve where there are no objections. Does that make sense for the council? So we'll see how it works. Is there anyone present to speak to item number 14? And the reason that we had was that if we suspended it beforehand, then if we spent it beforehand for all of the items, then we would never know if somebody would like to see it passed in 2 steps or not, and they would have already voted to suspend it. And so it didn't make sense for us to do it in advance, and if we decided to send it to committee, that would also be problematic if we had in turn already voted to suspend Rule 19 to take that particular item up in one vote. Is there anyone present to speak to item 14?
Mr. President, TJ Plant, City Hall. I can speak to it, but I know Helen Colton-Harris, Commissioner of HHS, is still on the call. I'm not sure if she wants to address it or if she wants me to.
Commissioner?
Okay, I'll take this one. So what we're asking for is a transfer from the salaries and savings salary line item to the OTPS line item for $14,400 to do increased security around the 311 State Street property where HHS is housed. This was a request by the commissioner, and we're happy to accommodate the request.
Thank you. Are there any questions or comments regarding this order from the council? Seeing none, Madam Clerk, can you please call the roll on approving this transfer?
On approving item number 14, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yeah.
Yes. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes. Is there anyone present to speak to item number 15?
Mr. President, I can do that. The bill of a prior year, I can do that as well.
Thank you.
So this is a request to spend current year money for a bill of, from fiscal year 2000 for $88.26 for the New England Veterinary Center for TJO.
Thank you. Are there any questions or comments from the council regarding this order? Seeing none, Madam Clerk, can you please call the roll on approving this order?
On approving item number 15, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yes.
Yes. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes. Is there anyone present to speak to item number 16?
Mr. President, I believe Bob Maggi from the IT department is on the Zoom to
Yes,
answer.
I am. I can speak to this. This is
Can you please state your name and address for the record?
Bob Maggi. I'm the Deputy CIO for the City of Springfield. This is a 5-year lease for the replacement of all desktops and laptops in the City of Springfield. The reason we went with the lease is so we wouldn't be given a one-time hit to the general fund, or and it's easier to go for a 5-year lease and pay in smaller increment. This is for approximately 370 desktops, 212 laptops with docking stations, and 12 IT desktops. This also includes, and I don't want to get into it on an open meeting, but it's going to block all the holes for the city security because we're going to move to Windows 10, which is a security problem for the only security problem left in the City of Springfield. And I don't want to go into too much detail about that in an open meeting, but this would be a huge advantage to the city to go with this.
Thank you. Are there any questions or comments from the council?
I have a question.
Councilor Allen, the floor is yours.
Thanks, Mr. President. Bob, thanks. How have we done it up till now, Bob? This sounds like a good idea going forward, but what's been the approach up till now?
The approach has been a one-time payment, but I mean, years ago, you could buy a laptop for and a desktop for $200 or $300. But the ones today with the new Windows 10 are a lot more than that. So it being a huge expense to go with a one-time payment. Our desktops and laptops now are about 6 years old, and we like to get on a rotating schedule to keep up with latest technology every 5 years. So that's why we picked this avenue.
Okay, so it's a cost-saving thing primarily.
Yes.
How does it help on the technology side?
Because every 5 years when the lease is up, we can renew a lease and update to new equipment again, which we should be doing. We should have been doing all along. But today, security is a huge issue. As you can see what happened at the school department. And these issues we weren't having 5, 6 years ago because nobody was attacking your system 100 times a day on a daily basis like is happening now.
Have we had the issue at this, similar to what the school department had? Have we had that kind of a threat?
We get attacked on a daily basis. Yes, we do, Counselor, and we've thwarted everyone. Some of them luckily, and some of them with the equipment that we put in place. But we do have high technical equipment to stop 99.9% of the attacks. But like you see, the Pentagon and huge places get hit. So I mean, you can never say never.
Right. No, that sounds good. Last question for me, anyway. You said that they're more expensive now. It used to be $200 or $300, but with Windows 10 or Windows 10 or something, it's more. What would be an example of how much it would be now for a desk?
Well, a good laptop in the city, we're spending a little bit over $1,000, probably between $1,100 and $1,200 with a docking station, a mouse, and a keyboard, and a monitor. Because now people can just grab their laptops and go home, and when they get to work, they just snap it into a docking station. They have a desktop. And we're looking for as many, that's why we're getting 212 of them. So a lot of people can work remotely. In situations like this, we really scrambled before, and the school department helped us out with a lot of old laptops, and we got them out in the field for a lot of our people to use. But I mean, it's really not the way to go using old machines like we're using. People should have a machine that they can actually work on.
Okay, great. Thanks for the answers to the questions.
Thank you, Councilor Allen. Are there any other questions or comments from the council? Seeing none, Madam Clerk, can you please call the roll on approving this order?
On approving item number 16, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes. Is there anyone present to speak to item number 17?
Yes.
Please state your name and address for the record.
Good evening. For the record, my name is Attorney Melvin Altman. I'm an associate city solicitor for the City of Springfield Law Department. I reside at 15 Cedric Street in Springfield. What you have before you, this involves a foreclosed tax title property being sold to an abutter who will use the property as a fenced-in side yard and garden. It will combine the property with her house at E3 Green Street.
Thank you. Are there any questions or comments from the council regarding this order? Seeing none, Madam Clerk, can you please call the roll on approving this order?
On approving item number 17, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
Yes.
Yes. Councilor Walsh absent. Councilor Williams.
Yes.
Yes. Councilor Allen.
Yes.
Yes. Councilor Letterman.
Yes.
Yes. Councilor Edwards.
Yes.
Yes. Councilor Brown.
Yes.
Yes. Councilor Hurst.
Yes. Is there anyone present to speak to item number 18?
Yes, this is Attorney Melvin Altman again. This is another foreclosed tax title property being sold to an abutter. who will use the property as a fenced-in side yard. It will combine the property with her house at 78 Andrew Street.
Thank you. Are there any questions or comments from the council regarding this order? Seeing none, Madam Clerk, can you please call the roll on this order?
On approving item number 18, Counselor Gomez.
Yes.
Yes. Counselor Whitfield.
Yes.
Yes. Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Curran.
Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes. Madam Clerk, can you please call the roll on suspending Rule 19 for orders 14 through 18?
On the suspension of Rule 19 for items 14 through 18, Counselor Gomez.
Yes.
Yes. Counselor Whitfield.
Yes.
Yes. Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Curran. Counselor Curran.
Yes. Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes, the orders have been approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is amending Chapter 355, the TIF ordinance. It's on first, second, and third step.
Thank you, Madam Clerk. Is there anyone present to speak to this item? Is there anyone present to speak? Oh, I'm sorry, Counselor Ramos.
Thank you, Mr. President. Yes, this is second and third step for the TIF ordinance that we voted on at the last regular meeting. There were several counselors who signed on as co-sponsors, and I'll be happy to answer any questions that anybody has, but I think that we explained it pretty thoroughly at the last meeting, and I'm hoping for a vote in the affirmative this evening.
Thank you, Counselor Ramos. If there are no questions or comments from the council, Madam Clerk, this is on for second and third steps, so if you could please call the roll on invoking Rule 22C so we can take this ordinance up in one vote, it'd be greatly appreciated.
On invoking Rule 22C, Counselor Gomez.
Yes.
Yes. Counselor Whitfield.
Yes.
Yes. Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Curran.
Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes, Madam Clerk, can you please call the roll on the ordinance?
On second
Approving
and
the
third,
ordinance?
on approving the ordinance, second and third step, Counselor Gomez.
Yes.
Yes. Counselor Whitfield.
Yes.
Yes. Counselor Davila. Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Curran.
Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes, the ordinance is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda, number 20, proposed amendment to the city charter, chapter C, section 44D.
Thank you, Madam Clerk. Is there anyone present to speak to this item?
Yes, Mr. President. Thank you.
Councilor Whitfield.
Thank you. Mr. President, I bring this charter change forward because I think the current system is unfair, being based on the spelling of someone's last name. I do agree that incumbents have earned the right to be at the top of the ballot. However, I think being listed first, second, third, fourth, or fifth is unfair based on the spelling of someone's last name. And so I think that acting in fairness and equality, we should consider changing the charter so that there will be a random selection of how the names, incumbent names are listed. I do think that all ward councilors also earn the right to remain first on the ballot in their positions on the ballot, because they too have also earned it. We've all been challengers at one time, and we got elected based on the work that we did. And I think that the work that we do on the council over 2 years speaks to us being positioned on the top part of the ballot. And so I am requesting a charter change. It is a mass general law that incumbents are placed on the top of the ballot in alphabetical order. However, we do reserve the right as a city to change the order of the charter. We have to send it to the state, and they get about 4 weeks to review it and make a decision on if we can do this or not. And I'll have Tom Moore speak to that in more detail. But I think everyone in the country is talking about fairness. And so I just wanted to speak to what Jay said in the public speak out, that some of the information that he had is not accurate. It is a mass general law that all incumbents are listed first and in alphabetical order. And the only section that I want to change is the at-large city council be listed first still, but randomly selected in the order that they will be placed on the ballot. I spoke to Commissioner Gladys Loyola. She said there would not be any additional costs to take the step. And she also said that the random choosing of the ballot selection would be done in a board meeting for the elections office. And so we wouldn't have any process, we wouldn't have anything to do with that process. And so I just wanted the city council to consider this fair and equitable change. And after Tom Moore speaks about how the change will take place, I will be happy to answer any questions that you may have.
Thank you, Councilor Whitfield. If councilors could remind themselves to put themselves on mute if they are not speaking, it'd be greatly appreciated. Attorney Moore, are you present? If you could state your name and address for the record, it'd be greatly appreciated.
Absolutely. Thank you, Mr. President. Attorney Thomas Moore with the City of Springfield Law Department, all one place, Springfield, Massachusetts. As Councilor Whitfield very correctly stated, Mass General Law controls the order of ballots, and certain sections of Mass law allow a city or town to alter that based on making changes to their charter. So that's what the councilor is proposing in this instance. The way the procedure would take place would be that if the council was to approve proceeding forward with the charter change, they would be authorizing the city clerk to schedule a public hearing. There has to be like an advertisement in the newspaper, and it would come back before this body for a final approval vote. And at that point, it would take the mayor also to concur with approval. And if the mayor approves, it would then be sent to the state attorney general's office. They do what's called like a constitutional review of the proposal. And if they approve the measure, they have about 4 weeks to decide that. If they approve the measure, it goes into effect immediately. And if they don't, what they'll do is they'll send back what they're recommending for revisions. And then the city council could amend the measure to comply with that. And then it would take effect at that point. So that's really the procedure of it. I'd be happy to answer any questions about, kind of the legality parts of it. But I think Councilor Whitfield spoke very eloquently as to where this sort of originates and, really what we're looking for. There are some other communities that do random draws for all their elections. Councilor asked me to look into that. So we wouldn't be the only community that does that. I think it's a measure that at this point, could be looked at in a public hearing and really could be advanced to the state level. Again, if this body and the mayor agreed.
Thank you. Thank you, Attorney
sorry.
Moore. Counselor Whitfield, did you want to add something?
Yes, I just wanted to add the fairness comes in where usually if you're listed first on the ballot, you, by nature of just being in that position, earn anywhere from 3 to 10% more of the votes in what any particular city or county. And so the fairness will come in that everyone will get a chance to gain those votes in a fair process, and not just because your last name begins with an A or a B or a C or D, however it goes down the list. And so that's where the fairness comes in.
And just for reference, for anybody who's listening, for the actual statute that Counselor had referenced originally, it's General Law Chapter 54, Section 42 that deals with the incumbency and why they are allowed by law to be placed first. So just for statutory reference.
Thank you, Attorney Moore. I see Counselor Allen's hand raised in the queue, followed by Counselor Brown.
Sorry, thanks, Mr. President. So I'm just trying to understand it completely. So instead of the incumbents being listed in alphabetical order, as has been, they would be listed in random order, but they would still be listed separately from the people who are running the challengers.
Yes, they will still be listed first on the ballot as they currently are. They just would be randomly selected. So number one could still be number one if he's chosen for that particular spot. But it'll be a more fair process that everyone gets an opportunity to land in the number 1, 2, 3, 4 spot. But yes, incumbents will still be listed first on the ballot. As
So
it is right now, currently.
So I go to the ballot, and when it says city council at large or something, it would have whoever of the 5 city council or at large current ones are running again, could be anywhere from 1 to 5, and they would be listed randomly. And then after that would be listed the challengers.
Yes.
And the challengers, would they be listed alphabetically or would they be random?
Alphabetically.
Right.
Alphabetically. Okay, thanks. That's my questions. Thanks.
You're welcome.
Thank you, Counselor Allen. Counselor Brown, followed by Counselor Curran.
Yes, I was just curious as far as making it fair. If, say, there is an individual with a last name A, and they come from an economically deprived situation where they can't financially compete with a person whose last name begins with a W, is that taken in consideration? Is finance taken in consideration instead of the last name?
That's a great question. No, that hasn't been taken in consideration because I don't know that we have to reveal our financial status when we run for public office locally. I mean, I've never had to release my tax return, so I don't know how we would know that information. But just honestly speaking, that has not been, that wasn't considered when I was researching.
No, I don't mean as far as tax returns. I'm talking about just like we were talking as far as the vote on 2 or whatever that last vote was. There are certain people who have certain fundraising capability. So a person like myself, I would have an unfair advantage of a person whose last name is A. So is that taken into consideration? So what I mean is last name somewhat with the alphabetical order to me isn't what's unfair. What's unfair to me is the ability for a person with finances being able to compete and being able to market themselves in order to have a chance to obtain office. That's really like my only concern, as far as when we're starting to play with things like this. It's now you're taking a person whose last name is A, they have $1,000 in their account to actually run. They're a great candidate, they're a hardworking candidate, but now if they had any type of an advantage, now it's taken away from them. And a person who has $10,000 in their fundraising account and their last name is W, it's just going to be a lot difficult. So it's just always kind of, when you talk about fairness, it's just always looking at it and another person's point of view.
No, yeah, and I respect your point of view. Just to honestly speak, I didn't look at the consideration of the financial aspect. If that's something that you want to look at, go for it. I just looked at the fairness of who gets a percentage more of votes based on where they're placed on the ballot. And studies have shown that if you're placed on the ballot first, you get between 3 to 10% more votes just for the positioning of your name. I haven't seen any studies that says if you run and you have less in your account, or you're not able to raise those type of finances, that that's a disadvantage, because I know I didn't raise a lot of money, or I didn't have as much in my account as some of my other opponents, but I worked. And so I guess sometimes it's not about what you have in finances, about the work that you put in. And so honestly, and I'm just answering your question, and I do respect it, that's just not something that I looked at personally.
Thank you, Councilor Whitfield. Thank you, Councilor Brown. Councilor Curran, followed by Councilor Davila.
Councilor Whitfield, as to your amendment, would it be more fair, you think, maybe just put everybody into a lottery? I mean, why have the incumbents treated differently than people who are challenging the system? I would think that if we just take everyone's name who qualifies for the 100 signatures and we put them all into the lottery system as you're proposing, doesn't that make a lot more sense? Because right now what you're proposing is a kind of a hybrid system. You're putting the incumbents in one level and then the challengers on another. We're all residents of Springfield, whoever's running. Why don't we just put everyone's name into a hat, and wherever the city clerk polls, we put that person, that resident of Springfield, on the ballot in the order that they're chosen in the lottery, rather than incumbents versus challengers. I think, isn't that a more fair system? And isn't it more fair for those people who are trying to break into city government?
I respect that, and I did think about that. I thought about it a lot. And I remember being a challenger, and I had no idea where I was going to be positioned on the ballot, to be honest. But what I do know is that as incumbents, we work hard. We worked hard as challengers to get in a position, and then we get into the position, we work hard. This is not a part-time job, although that's what it's considered, and that is how we are paid. This is not a part-time position for those who work extremely hard almost every day, dealing with constituents' concerns, constituents' complaints, working on changing legislation, coming to city council meetings, going to committee meetings almost daily. So hold on, I'm answering your question, and then I'll be happy to listen. And so, we were voted in, we worked hard to get voted in, and then we work even more hard when we're in the position. And I think that while we're in the position, that we deserve some type of benefits while we're in the position, because we did work hard to get here. And I don't think that, I think when challengers win, they should also have the same opportunity to be listed first, and also have the opportunity to be randomly selected when they're in that incumbent spot.
Respectfully, I don't think we're entitled to any benefits to winning. I just do think that if you're going to run and you're a resident of Springfield, if we're going to embrace equity and equality of purpose, I think probably the most fair way to do it, whether you're an incumbent city councilor or you're a challenger, just a resident of Springfield who gets the 100 signatures to qualify for the ballot, then everybody should be treated equally across the board. I don't think it makes any sense at all to treat the incumbents, if we're going to change the system that we have that's in mass general laws across the state. If we're going to change the system, let's change the system and let's just go all the way. And we'll take everybody and put his name in a hat, and that would be fair. I don't think as incumbent city councilors, we really should, we're picking winners. And if what you're saying is true, the people higher in the ballot get more percentage, then let's remedy that. Let's make it a total system. And if we can amend your ordinance to that, I think that would actually go a lot further than what you're proposing. If you're trying to make it more equitable, let's go equitable. Let's put every name to whoever gets 100 signatures to qualify for the ballot. Let's put them in a lottery system and let the city clerk pick those at-large candidates, regardless of whether or not they're a city councilor or not. I don't think being elected to the city council should bestow you with any special privileges from a resident just trying to get on the city council. And I think that would solve what Councilor Brown was alluding to, financial aspect of it as well.
Thank you, Councilor Curran, Councilor Whitfield. I will give you an opportunity to respond, and then we're going to move on. I also will remind councilors that this is on for first step, and it also possibly can be sent to committee where we can have more extensive discussion on it also. So Councilor Whitfield, followed by Councilor Davila.
Thank you, Mr. President, and I'll be respectful of the time. Thank you for your opinion, Sean, Councilor Curran. I know for me, I work extremely hard every day, and I'm not looking for a privilege. I'm looking for fairness, and I think that is fair that most counselors work very hard in their positions. And just like I wouldn't want to change the order of the ward, I think that they work hard for the positions that they're in. I'm gonna respectfully agree to disagree with you. And I didn't say that the position that you land on the ballot, I said the number one position, the first position is what gives you the benefits and gives you the extra percentage of votes. The number one position, not number 2, 3, 4, 5, and so on. And so while I respect what you're saying, if you want to go ahead and make, I don't know if I want that amendment made, but I'll just say that, Tom. Can you go ahead and add?
Yeah, I don't mean to lengthen the proceeding. I will be very brief. I apologize for even interjecting. I just, the counselor had made a interesting point, and there is litigation on this. They did, in the 70s, there was litigation extensively about whether this was constitutional or not. And there's a landmark federal case about it that talked about how it was an equal protection argument under the 14th Amendment that basically it's not unknown that voters will often go to the polls and not be totally informed about every race on the ballot. Sometimes in bigger states in particular, there's a ton of things on a ballot and not everybody's aware of every race. So the court in its reasoning talked about the idea that having an incumbent listed at the top at least provides people who don't have the knowledge of a certain race the opportunity to go, well, this person's done this job before, and at the very minimum, they're aware of the responsibilities and what the job entails. And to speak to Councilor Whitfield's point, they've worked at the position for a number of years, so they're at least at a base threshold more familiar with it than a candidate who has not yet done that work. So that's why it was one of the reasons that the court gave. Again, that's not my personal reasonings, but I wanted to fill in kind of the blanks and why this system still is allowed to go on. There has been litigation at this at the federal level, and it was decided that it was constitutional. Whether you could change it, you certainly can, but it is in a system that has been ruled unconstitutional at the current because of that reasoning.
Thank you, Attorney Moore. Councilor Davila, followed by Councilor.
Thank you, Mr. President. I will try to be as brief as possible. As we engaging in this debate and in this exchange of ideas, I cannot help but to think that ranked choice voting might have resolved a lot of these problems that we are facing. With that being said, my question either to Councilor Whitfield or Attorney Moore, regarding this drawing system, can you tell me what that will look like? And would that be open to the public as well?
Sure, Councilor. I think in the end, the drawing would be done by the city clerk's office in conjunction with the election commissioner's office. And it would be something that would be open to the public. That's something that in my research, that's one of the things you saw was that people would be able to see the drawing, that it would be a public event. So I think that would make sense for Springfield to do the same.
Right, because I did see that was going to be open to the candidates or the representative.
Candidates would have a representative could be there. Of course, that's
Okay.
always a law by law, but I did see that it was open to the public in other places. I think it makes a lot of sense to do that.
And the public. Okay. All right, thank you. I will circle back. I will use my time for now.
Thank you, Councilor Davila. Councilor Ramos.
Mr. President, I'll be brief. I think this it's a good conversation to have. I think it's worth discussing. I think it may be more appropriate to have this discussion in committee so that we can, discuss different ideas and have a conversation as to what the best course of action is. I didn't realize that this was a change to the charter. And if that's the case, then I don't want to overcomplicate this issue, but there are, I think Councilor Fenton has discussed in the past the need to revisit the charter and have a conversation. In fact, I think that he had mentioned before the fact that the Charter Commission of the City of Springfield has been vacant for several years. And this may be an opportunity to, have a conversation about whether or not it should be something that we want to push for, to have a discussion as to what changes have to be made to the city charter. I'm just throwing that out there. I don't mean to overcomplicate things, but if we are going to discuss the charter, then there are several other issues that we need to discuss other than this one.
Thank you, Councilor Ramos, Councilor Fenton, followed by Councilor Curran.
Thank you, Mr. President. Believe it or not, people have raised this issue to me many times over the course of the past 11 years. And frequently the issue gets raised by challengers, complaining about the fact that incumbents get to be listed first. That advantage is in addition to the advantage of having your incumbency listed as a characteristic on the ballot itself. That's a benefit that isn't available to challengers for elected office, regardless of what they may be doing in their public or private sector work. So I understand Councilor Whitfield's desire to separate the two, the incumbents and the challengers, but I would argue that they already are. We already are separated by virtue of the fact that our incumbency is expressly listed under our name, regardless of what order we're placed in. And so I agree with Councilor Curran that the most fair way to do this is to have a drawing for all the seats and determine the whole order. And the only advantage that an incumbent should get, if any, should be that their identity and characteristic as an incumbent is listed under their name. It's worth noting that this is how most cities do it. It's how Boston does it. It's how Worcester does it. It's how West Springfield does it, many other places. So we're not the only ones in the state to have incumbents listed at the top of an at-large ballot, but we are an outlier in that respect. And I think that over the course of time, you can see the results of that in our municipal elections. It's, you look back over the last 30 years and we're all incumbents on the phone. So I'm talking about myself too. I don't mean any disrespect to anybody, but you look at the election results over the last 30 years and there's only like one incumbent city council at large candidate that's lost before, maybe two. And Whitfield's right. We do a lot of really good work. And we work hard, but there are a lot of vestiges and advantages of incumbency. And I don't think that in addition to that, we should enjoy being at the top of the ballot. So with that, if it goes to committee, I'd be happy to participate in the discussion further. I've sort of avoided bringing it up all of these years that it's been raised by people to me privately. But now that it's here, I think we have to confront it head on. That's my 2 cents.
Thank you,
I appreciate your comment, Council President. I just want some clarification. When you said Boston does it, West Springfield does it, and these other towns, what does it are you talking about?
They do the lottery system, Councilor. So they get all the at-large candidates and they either put the names in a hat or numbers in a bingo machine and have a public drawing.
And do they list incumbents first, or is it incumbents and challengers?
Those particular places do not list incumbents first. I actually, in anticipation of this tonight, I called Cambridge to see what our good friend Anthony Wilson is up to out there. And in Cambridge, they do it actually alphabetically throughout, no lottery. So, the point is just that the system does vary across the state. It's not perfectly consistent and uniform. But as far as I can see, most of our peer cities are doing lottery systems and not separating the incumbents and the challengers.
Thank you.
Thank you, Councilor Fenton, Councilor Curran, followed by Councilor Davila.
I was going to concur with Councilor Ramos, actually, and Councilor Fenton, that maybe this is an issue that can be discussed further in committee. And I also like to get the perspective of Councilor Walsh, as the senior counselor here, that of her opinion on the issue. I know she's absent tonight, so I would second Councilor Ramos's motion to move. If that.
I don't know if you would second in the future, Councilor Curran?
I'll make the motion myself. I'll make the motion.
Okay, so there's a motion on the floor made by Councilor Curran to send this item to committee. I know we have two other councilors with their hands raised. Is there a second to this motion? And then, is there a second to this motion?
A second.
Second.
Motion made by Councilor Curran, seconded by Councilor Brown. On the motion, Councilor Davila, followed by Councilor Williams.
Hey, sorry, I was muted. Thank you, Mr. President. So a quick question regarding the word incumbent. I do believe, Attorney Moore, that a person has the right to write something after their name. Is that correct? Even non-incumbents could write something, whether retired, whatever.
Right, yeah, there's some kind of information that goes with the candidate's name. It generally is like if it doesn't say incumbency about an elected office, it'll say something like a profession. You know, oftentimes that's what it'll say. So yeah, that's true.
Right, so that's also extended to the challenger. So in theory, a non-incumbent could write challenger.
I think they're identified as challengers because incumbents have this little designation that goes in there automatically. But yeah, you could write in there challenger, Attorney Tom Moore, if it were me. Yeah, you could write that. You know, that I think that they allow you a certain amount of identification. Yeah,
that's what I thought. And so thank you, Attorney Moore. Yeah, Mr. President, this is a great conversation, something that we need to look at seriously. But I believe might have been Councilor Curran alluded before, there might be constitutional issues here, and I think we really need to dot our I's and cross our T's. And I would love to participate and follow up this more of this important debate at the subcommittee meetings. Thank
you, Councilor Davila. There's a motion on the floor made by Councilor Curran, seconded by Councilor Brown. Councilor Williams, followed by Councilor Whitfield on the motion.
Thank you, Mr. President. I will also be brief. I'm just a little ward counselor, so I don't want to bone in this fight, but I will say, I will say that I think that this certainly deserves additional conversation. I think a lot of good ideas floating around. If we can come to a consensus, then I think we might get somewhere. As Councilor Fenton alluded to, this has been a topic of conversation since I've actually been in office myself. So, again, and also Councilor Ramos' point, which I think was well taken, was the fact that this also would be a charter change. That the buy-in from the mayor is crucial to this even becoming the actuality. So again, there's a lot of people that have to weigh in on this, and I think it's in the best interest of the idea if we move to committee. So I agree with the motion.
Thank you, Councilor Williams. Councilor Whitfield.
Thank you, Mr. President, and thank everyone for their feedback and their opinion. I humbly respect it all. And since you do have additional questions, I agree that we can move this to committee. I think it goes to general government. I'm not sure, but
yes.
Council President, you can make that determination. And yes, Attorney Moore?
Just one point of order. This particular change to the charter, because it doesn't involve a change to the composition of the form of government or something major like that, does not involve a charter commission. So we are not required to go through a charter commission process. It goes directly to the Attorney General if we were to approve it by the mayor and the council. Certain other charter amendments, of course, dealing with like the makeup of the body, that's all charter commission stuff. This one is not. That's all I want to add.
I appreciate that. So thank you all for your feedback, and I will sleep on it, take it into consideration, and wait for the meeting.
Thank you, Councilor Whitfield. There's a motion on the floor made by Councilor Curran, seconded by Councilor Brown to send this item to the General Government Committee. Madam Clerk, can you please call the roll on the motion?
On the motion to committee for item number 20, Counselor Gomez.
Yes.
Yes. Counselor Whitfield.
Sure, why not?
Sure, why not? Counselor Davila.
Yes.
Yes. Counselor Fenton.
Yes.
Yes. Counselor Karen.
Yes.
Yes. Counselor Ramos.
Yes.
Yes. Counselor Walsh absent. Counselor Williams.
Yes.
Yes. Counselor Allen.
Yes.
Yes. Counselor Letterman.
Yes.
Yes. Counselor Edwards.
Yes.
Yes. Counselor Brown.
Yes.
Yes. Counselor Hurst.
Yes, this item will go to the General Government Committee. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda, item number 21, is a private ways amending chapter 338. It's on for first step.
Thank you. Is there anyone present to speak to this item? Councilor Ramos.
Mr. President, thank you. I would like to speak on the item. I want to see if Attorney Moore wants to speak first and kind of give an overview.
Sure, I'd be happy to, Counselor. The proposed item is adding two new articles into our existing city ordinances on our streets. So what's being proposed is essentially for the city to be allowed to basically adopt some of the authority presented to it through General Law Chapter 40, Section 6N, which deals with private ways. And basically what we're doing here is allowing the city to take certain actions where requested by the public or where it deems necessary through its DPW department to take actions to make minor repairs or major repairs to public ways, while at the same time not adopting them as public ways and keeping them private so that we don't absorb the type of liability that goes with adopting a way as a public way. So, you know, there's really two pieces to it. One is for what are considered minor or temporary repairs, and then the other for major temporary repairs. One is a process by which the city would be involved through the DPW department and the city council in making a decision whether to make minor repairs to a private way. The other is something that would be done by petition of the public to try to request major repairs be done. And there's a process that also involves the city council to get approval for that as well. There's a second article that also discusses private developers having to meet certain requirements through our DPW department to be able to get permits to get, you know, curb cuts or new driveway construction on a private way that connects to a public way. So I think it's a step to sort of give the city more authority and more ability to deal with issues of quality of life and with infrastructure within private ways. And it manages to avoid adding liability to our ledger, which as somebody from the law department, I always appreciate. So I'd be happy to answer any questions, and I'll turn it over to Councilor Ramos to kind of go over any pieces of it he wanted to cover that I probably missed.
Thank you for the overview. That was very helpful. And I appreciate all of the work that you've done to help us get to this point. As many of you know, this is an ordinance that I've been working on for over a year now. It was sometime in 2019 where I actually proposed the ordinance, and it passed first step unanimously. Somewhere in between first and second step, it was sent to committee. We held a committee meeting, and I believe it was Councilor Fenton who had some legality questions, at which time I requested a legal review from Attorney Pakula to review the questions that were asked in that committee meeting. I have since then received the response. This ordinance has been reviewed by the law department, both by Attorney Pakula and Attorney Moore. And it does address and accomplish all of the issues that I was trying to accomplish with this type of legislation. It was my intention to bring it back sometime in the spring. Obviously, COVID delayed the process, and I was unable to bring it back until now. So here we are. You've all heard me talk about private ways over and over and over again. We've all heard, you know, from our constituents regarding the issues with developers building structures on private ways and failing to pave these dirt roads or to bring them up to standard compared to the rest of the city. It's an issue that is especially concerning here in my ward, in Ward 8, where in Indian Orchard there are a lot of private ways and a lot of developers who continue to build these beautiful houses, beautiful homes on dirt roads, and then they leave the burden of paving the streets to the city. In fact, there have been instances where they actually lied to the homeowner and say that the city is going to be paving the street before they actually, buy the house, and then they find out later that that was in fact a lie. So the ordinance is intended to put into practice put into law what the DPW has been putting into practice to prevent this sort of issue from happening again. The added addition of the curb cuts, the permit for the curb cuts is again another layer that will help us identify which proposed development is coming down the pike. Council Williams just ran into an issue in his ward where a developer was going to build a house and no one was notified, no one knew what was going on. In that event, this would have triggered a special permit because of the curb cut. Not a special permit, actually a permit for the DPW. So it would have required a permit from Chris Signoli in order to get that curb cut. So again, private ways has been an issue for a very long time. We're going to continue having this conversation. In fact, I've requested that Council Williams put together a subcommittee meeting to discuss how we're going to fund the existing private ways and how we're going to fund the improvement to those existing private ways so that we could turn them into public ways and put them on the list of public ways so that we can get Chapter 90 funding for them. I've had that discussion with TJ in the past week, and we're going to hold a subcommittee meeting to continue discussions on how we're going to improve existing private ways. But this ordinance, again, is intended to prevent developers from continuing to develop these houses and structures on private ways without actually paving the road to city standards. So I hope that you will all consider supporting this ordinance. And if you have any questions, I'll be happy to answer them.
Thank you, Councilor Ramos. Councilor Williams, followed by Councilor Letterman.
Thank you, Mr. President. So this question may be posed to someone in finance, maybe Lindsay or Attorney Moore, you might know the answer to it as well. But just in regards, so I know that general or Chapter 90 funds cannot be used on private ways. So I was just wondering in regards to some of these smaller or larger repairs that would take place dependent on the scope of the issue, where are, will the general fund money be used? What pot of money will be used for that?
Sure, I think I can answer part of that, hopefully well enough. So the minor temporary repairs are something that would take place on the city's appropriation. It would be something the city would have to appropriate money for. The major temporary repairs will be conducted through betterment assessments for the estates at the private way. So there's a petition that would have to be filed by those property owners, and I believe it's 50% of the estates on the private way are affected by the improvements that are being considered. And if the improvements were approved and it went forward, there would be betterment assessments leveled on the properties that were affected by the improvements. People are allowed to enter into payment agreements, so it's not as if if it's above $200, I think you're allowed to enter into an agreement with the city to help pay it back in installments that are much more affordable. So it kind of takes into account the idea that you get whacked with a huge bill or something like that you didn't want. So yes, there is a process by which the money is covered, and for the major repairs, it would not be coming out of the city's funds. It would come from the betterment assessment.
Okay, and just a quick follow-up, Mr. President, if I can, just in regards to, so, I've certainly heard about this issue, especially in the acres where there's several private ways. So my question is, just in regards to, question just floated out of my head just like that quickly. Trust me, I've been talking so much about it. It's been exhausting, but I will say, just in regards to the services that are, I guess, reduced because folks live on a private way, Is that a part of this at all? Because I know that, I've heard from residents that, complain that, the trash, they have to pay an additional fees or anything associated with that. Maybe Attorney Moore knows the answer to that.
Attorney Moore?
Yeah, I'm sorry. My audio was messing up there. I didn't get the question. Get the whole question. I'm sorry. I'd be happy to answer it.
No, I was wondering, Attorney, if there's just, any relief that this ordinance or maybe something in the future can speak to the reduction of services that folks receive on private ways. Because I know I've heard from residents that they've had to pay additional, cost for things that Springfield residents might not have to pay for or not as much for. So I'm just wondering.
This ordinance does not address that, Counselor. I mean, if you wanted to, I'd be happy to kind of look into that for you. If I, off the top of my head, I honestly don't have much knowledge of the subject, but I'd be happy to kind of dig into it.
Yeah, I certainly don't want to stall the because I know Councilor Ramos has been working at this, but I really think there's a need there. And if there is funding from the city that can be put towards that, I think that might go a long way. So I just want to, if we can I can connect with you offline on that.
Perfect.
Mr. President, can I respond?
Thank you, Councilor Williams. You absolutely can. Councilor Ramos?
Yeah, so Councilor Williams brings up a good point. And that's one of my arguments with why this ordinance is important. Every homeowner who lives in a private way pays the same amount of taxes as everybody else. They all pay the same tax rate. However, their street looks a lot different than some of our streets look, right? And so that's another reason why it's important to pass this ordinance, to make sure that in the future, we're not allowing developers to build houses on streets that look like that and then not pave those roads to look like the rest of the streets in the city of Springfield. So thank you for bringing up that point, Councilor, and I'll be happy to, to talk about that with you, talk more offline.
Thank you, Councilor Ramos, Councilor Letterman, followed by Councilor Davila and Councilor Fenton. I know you're having issues with raising your hand, so don't let me forget you. You are after Councilor Davila.
Thanks very much, Mr. President. I just rise in support of the legislation. I want to again thank our colleague, Councilor Ramos, for his diligent work on this. I remember when the issue of private ways first really began bubbling up on our agenda was about 3 years ago after one of the town hall style meetings that I think the majority of the council we had attended at Rebecca Johnson School, and it was a particular street actually in Councilor Ramos's ward. The whole street turned out. And what we really, I think, learned was that not only is this necessary for neighborhood quality of life, but it's also necessary for a consumer protection aspect to make sure that individuals who are coming in and purchasing these homes, many of whom have dreamed of home ownership their whole lives, are able to be assured in the future that they're going to be able to access the city services that they are entitled to, really and truly. In the case of that particular street, they were sort of lucky. It was at a point where we were able to eventually get it accepted as a public way, and I believe it actually got paved with Chapter 90 funds following that. But as we know, many of the streets in districts, especially in Councilor Williams' district and Councilor Ramos' district, are nowhere near the status of being accepted as a public way. So I'm very excited to see the legislation moving. I would ask the clerk to add me as a co-sponsor, and I look forward to seeing it really be implemented for future projects, and also to provide that avenue for individuals to get the streets up to par when they have a majority of their street willing to do so.
Thank you, Councilor Letterman, Councilor Davila, followed by Councilor Fenton.
Thank you, Mr. President. My compliments to Councilor Ramos and Williams for this due diligence. It is critical with all the development that we have here in the city of Springfield that people get what they pay for. And if they buy a brand new house, they expect to have a good looking, functional road. I definitely agree with that, but I just have some quick questions which I'm not clear about for Attorney Moore. My first one is, in the terms of definitions, and I'm just looking at the chapter 338 that was provided to us. So if I understand this, once a developer finishes building as a private way, they would have to pave the road, but the city is responsible for filling the potholes, correct? up to 3 feet.
Council, I'm afraid I don't understand your question. Under
What I'm saying is basically after the road is paved, the road is going to be originally paved by the developer of the lot, right? That's basically.
This is the private way we're talking about, right?
Right, absolutely.
Okay, yes,
Correct.
right. So the developer does the original paving, correct?
Right. So then any pothole thereafter, the city is responsible for fixing, correct?
I'm not sure that that's accurate. If it's a
Well, that's
private
why I
way,
asked, because I'm confused. I'm reading here. I'm just reading the definitions.
yeah. Which section are you in? Because I have it open. I'm looking at it myself. So are you looking at?
It says just 33861 definitions: minor temporary repairs, the filling with sand, gravel, or other suitable material.
Right. So the minor temporary repairs is not an obligation of the city. It's an option. So that's how you should think about it. So in other words, like the minor temporary repairs, if you look down at 33862, it's about the city make minor temporary repairs upon a private way in the city. Such repairs shall be made only as the Director of Public Works determines in his or her opinion, et cetera. So it is not an obligation. And I poorly kind of spoke to that when I did my summary, because I was a bit into the weeds and a little lost there. So yeah, it's an option. It expands our potential authority over private ways. It does not obligate us or present us with additional liability. That was something that we really had to address and work on. I was not involved in the previous iterations. This is my first kind of, foray into this subject. So that was one of the key pieces that we looked at, was making sure that we didn't add liability to the city.
Okay. Now, with that being said, the next question is, right underneath where it says private ways, it says any way which is not public way, but which has been open to the public for use for 6 years or more. Those 6 years or more, does that mean that the city doesn't have to repair it after 6 years? Or I don't know a road that won't have a hole after a couple of years, but that's throwing me off that 6 years definition there. What does that mean?
I mean, it just really, it doesn't, it's not a definition that attaches to conversion to a public way or city responsibility. It's really just, getting a time frame for when you would constitute that particular road a private way. And that's my understanding of that definition. I don't know if Councilor Ramos would want to add anything to that, but that's my understanding.
Basically, that wouldn't be something that people could say, this is private property, you got to get off the road, the public road. I mean, the private way.
I'm not sure, I'm not sure I understand the question totally.
What I'm saying is we built it. There's a private way. It's up. It's brand new. It's spanking brand new. It's 1 year after being built. And as I read this, it says, which has been open to the public use for 6 years or more. So if a regular citizen who does not live there is walking through that private way, will he be trespassing? Basically, that's my question. Can they argue this is private property?
Counselor, I could look into that for you. I'd probably you'd have to give me a second to read up on that. I mean, honestly, like you could ask a number of hypotheticals in a legal situation. I'd have to really look at that before I would answer you. Because my answer would be like a real answer, on our recording here. And there'd be a number of hypotheticals that I'm not going to think of that I'm going to answer, and I'm probably going to be wrong. So I can't answer that. Like I could look into it and give you a real answer, but I can't do it right here.
Okay. Maybe Councilor Ramos, you have a thought about that, sir? If you don't, it's okay.
I don't. I think that, I'm sure that the definition came from somewhere. It may be state law. It may be some sort of a comparison with another ordinance that was that defined private ways. But I don't know.
Yeah. The reason I asked, Mr. President, is I support this, the spirit of this, and it's a great thing. And I just would hate to see that we somehow end up in a position where we start secluding people from freely walking throughout the parts of the city. But those are my questions for now, Mr. President. Thank you.
Thank you, Councilor Davila, and I think there will be more of an opportunity, whether this either goes to committee or we take first step, for you to get the answer that you want to get. Councilor Fenton.
Thank you, Mr. President. Can you hear me?
We can.
Oh, okay, thanks. So this is a great idea. Thank you, Councilor Ramos, for your diligence on it. I don't remember that committee meeting or what I said, but I will go back and look at it. I think that we should pass first step tonight. And I think further that before the next meeting, there should be a committee meeting so that we can address some of these very detailed concerns. The only one that I'd like to raise at this time, and like I said, I will and fully intend to vote for this in the end. I just think that we have to flush through some of these issues, is exactly what Councilor Davila just said, which is that what do we do if somebody doesn't want it improved? And the 50% number of residents, to me, is an issue we'll have to discuss further in committee. I won't gobble up any more of anybody's time tonight, except to say that some of my neighbors, as we speak, are in the process of pursuing a petition to discontinue a private way. And so there are circumstances where you could think about residents being opposed to improvements happening over a private way. And I think that that's just something that we'll have to give further thought to in committee. One way to solve it would be to just take that 50% number and make it 100%. But I'm not going to try and solve it tonight. I support first step. And I would just ask that Councilor Ramos ensure that whatever the appropriate committee is between first and second step, have a meeting so that we can flush through it. Thank you.
Thank you. Thank you, Councilor Fenton. If there are no further questions, and I don't see any in the queue, Madam Clerk, can we please call the roll on taking first step on this ordinance?
On taking first step, Councilor Gomez?
Yes.
Yes. Councilor Whitfield?
Yes.
Yes. Councilor Davila?
Yes.
Yes. Councilor Fenton?
Yes.
Yes. Councilor Curran?
Yes.
Yes. Councilor Ramos?
Yes.
Yes. Councilor Walsh absent. Councilor Williams?
Yes.
Yes. Councilor Allen?
Yes.
Yes. Councilor Letterman?
Yes.
Yes. Councilor Edwards?
Yes.
Yes. Councilor Brown?
Yes.
Yes. Councilor Hurst?
Yes, this item will be sent to the General Government Committee. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is item number 22, 100th anniversary of passage of the 19th Amendment.
Is there anyone present to speak to this item?
Mr. President, Councilor Curran.
Councilor Curran, the floor is yours.
I just want to thank all of my colleagues for supporting this proclamation. This does mark the 100th anniversary of the passage of the 19th Amendment, guaranteeing the women's right to vote. And I thought it was important that the Springfield City Council acknowledged that. Also because we have a Springfield connection to that historic event, in that Frederick Huntington Gillette, a Springfield resident and a Springfield politician, was elected from Springfield and was elevated to being Speaker of the House of Representatives back in 1919, helped pass through that legislation 101 years ago. And as he passed the 19th Amendment as Speaker of the House of Representatives in the United States Congress, that legislation went on to the states for ratification in 1920. And so I think there was a tremendous Springfield connection on a momentous occasion of the 100th anniversary of the right to vote, and certainly for women. And certainly here in the city of Springfield, we need to emphasize our positive history. You know, I spoke to my colleague, former colleague in the state legislature, Benjamin Swan, and he always thought that we should have a freedom trail, much like in Boston, emphasizing our historical figures like John Brown or Larry O'Brien, or now as we bring to the table, Mr. Gillette, Speaker Gillette, that we have a proud history, an important history nationally, and a history that should be recognized. And so along with those individuals at the Springfield Museum of History, I'd like to bring this to the council's attention, and we certainly appreciate that unique aspect of our local history. It's kind of unique in the fact that we had a Speaker of the House, Mr. Gillette in Springfield, and a Vice President of the United States in Calvin Coolidge in Northampton. And that wasn't repeated till recently when we have a Speaker of the House, Nancy Pelosi, and a Vice President now with Kamala Harris from the same area. So it's a unique little bit of history, 100 years apart, but I think it's something that we should remember as the Springfield City Council and commemorate. And I'm glad that many of my colleagues thought the same. So I just bring it to your attention and hopefully bring it to a vote.
Thank you, Counselor. Are there any other questions or comments from the council regarding this resolve? Seeing none, Madam Clerk, will you please call the roll on approving this resolve?
On approving the resolution, Counselor Gomez?
Yes.
Yes. Counselor Whitfield?
Yes.
Yes. Counselor Davila?
Yes.
Yes. Counselor Fenton?
Yes.
Yes. Counselor Curran?
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
Yes.
Yes. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes, the resolve is approved. Madam Clerk, will you please call the next item on the agenda?
The next item on the agenda, item number 23, is Medicare for All.
Thank you. Is there anyone present to speak to this item?
Yes, Mr. President.
Counselor Letterman, the floor is yours.
Thank you so much, Mr. President, and thank you, colleagues. I rise today to introduce this resolution in support of Massachusetts Senate Bill 683 and House Bill 1194, commonly known as the Medicare for All bill. And I want to thank my colleagues, Councilor Gomez, Councilor Davila, Councilor Ramos, Councilor Whitfield, and Councilor Williams for their willingness to co-sponsor the resolution. And I especially also want to thank the many residents who took time to speak out earlier during our public portion, as well as the many community and labor organizations that sent in letters of support, including the Massachusetts Nurses Association and the Western Massachusetts Area Labor Federation. I really believe that, if we listen to the stories and experiences of the individuals who have been failed by our current healthcare system, we will recognize that we do need to make a bold change in how we pay to deliver care here in the Commonwealth and hopefully someday also in the United States. The legislation that this resolution seeks to support would create a single-payer healthcare system similar to the system that is administered by the U.S. Medicare system to ensure that all residents of the Commonwealth of Massachusetts have access to affordable, comprehensive healthcare without the challenges of high copays, deductibles, out-of-network charges, and out-of-pocket costs that plague our existing healthcare system. As we sit here today, our nation finds itself in the midst of one of the most challenging public health crises in our history, the COVID-19 pandemic. COVID-19 has laid bare the weaknesses and inequities of our healthcare system that focuses on employer-provided health insurance. As unemployment numbers have skyrocketed here in Massachusetts, so too has the number of uninsured individuals in our Commonwealth by 90%. Many of our constituents and neighbors have now lost access to health insurance that they were accustomed to, that they had paid for years through their employers, right when they were in danger of needing it the most, all because they might have been laid off or lost their job because of COVID-19. Even at its best, before the pandemic, the prevailing system of delivering health insurance left 200,000 Massachusetts residents without insurance, including 6,000 right here in the city of Springfield. Many more continued to be unable to access care even with insurance due to the high out-of-pocket costs, especially when they are in need of care the most. And you have to only look at some of the epidemics that our city has faced before the pandemic to see that the current system of delivering insurance is not equitable, nor is it meeting the needs of our constituents. When we look at the rates of asthma in the city of Springfield and the access to care that so many individuals have been prevented from receiving, that has made us the #1 named asthma capital in the United States, that is because of lack of access to preventative care. When we look at the opioid crisis and the numbers that continue to rise, when I used to hold meetings as the chair of the Committee on Health and Human Services, one of the big things we heard about was even when the beds were available for treatment, people couldn't access them, whether they were uninsured or in some cases underinsured. That is shameful, and we must make a change. We know that much of the costs of health insurance are driven by high administrative and profit overhead that private insurance carries. That can be as high as 30%. In our own municipal budget, we project to spend $71 million this fiscal year, and we estimate a more than 6% rise in healthcare costs annually in the coming years. Under our current system, those rising costs mean less dollars available for the services and resources that our community needs, and signal equally rising costs for both employers and employees in the private sector in coming years. My friends, the health of our family and neighbors should never have to be bartered. It is time that we stop treating access to healthcare as a privilege and that we come together to recognize healthcare as the human right that it is. Under the Massachusetts Medicare for All bill, the Massachusetts Healthcare Trust would guarantee medical care, including dental, vision, and hearing care for all Massachusetts residents, regardless of income or employment. By simplifying the way that we pay for healthcare, eliminating co-pays, deductibles, and other out-of-pocket expenses, as well as networks and tiers that limit provider choice by centralizing healthcare financing and cost control into a single independent public agency while keeping the delivery of care in private hands. So to be clear, people can keep their doctors and in fact have more choice to see any licensed practitioner in the Commonwealth and to keep their medical decisions between a doctor and a patient, not between a doctor, a patient, and a health insurance company. According to the Massachusetts Campaign for Single Payer Healthcare, under this system, we would save over $42 million annually in healthcare spending just as a municipality. And imagine what that would mean for private sector businesses, big and small, and entrepreneurs that are ready to go out on their own. In closing, colleagues, I would say that there is no doubt that a transition of this kind would be a massive change for the Commonwealth and for our residents and neighbors. But if we have learned anything from the COVID-19 pandemic, it's that we must act boldly in the name of public health. That is why I'm glad to bring this forward, this resolution, in hopes that we will join our neighboring communities of Holyoke, East Hampton, Northampton, and the city of Boston in signaling our support for the Commonwealth to move in this important direction. If anyone can do it, it's Massachusetts. I do want to point out that several of our local state legislators are already sponsors of this legislation. State Senator Eric Lesser, State Representative Jose Tosado, State Rep Bud Williams, State Rep Carlos Gonzalez, and former State Rep Ben Swan, who was known really as a champion of this piece of legislation during his time in the House of Representatives. I know some of my colleagues may want to share a few words as well, and I have asked State Representative Lindsay Sabadosa, who is the lead sponsor of the Medicare for All legislation in the House of Representatives, to join us just to say some quick words about the legislation and answer any questions folks have. And we're also joined by a dear friend of myself and also of Councilor Williams, Dr. Dawn Berwick, who is the former administrator of the Centers for Medicare and Medicaid Services and President Emeritus at the Institute for Healthcare Improvement. So, Mr. President, with your permission, I would like to invite them just to share some brief remarks.
Thank you, Councilor Letterman. Absolutely. Who's going first, Councilor Letterman?
I think we had planned for Representative Sabadosa, Mr. President.
Thank you. Please state your name and address for the record.
Yes, Lindsay Sabadosa, 237 Riverside Drive, Northampton, Massachusetts. Thank you, Mr. President, for allowing me to speak for a few minutes this evening. Good evening. I'm thrilled to be here with the Springfield City Council as you take up a resolution in support of Medicare for All. At the start of the 191st session of the General Court, I filed H 1194 in the House, and the companion bill S 683 was filed in the Senate by Senator Eldridge. Legislation that will create a state-level single-payer system in Massachusetts, providing quality, affordable health care without copays or deductibles, and with a focus on regional equity. While not new, these bills are the culmination of many years of organizing and work. But instead of viewing these bills as set in stone, we look at these bills as living documents. They reflect the value of healthcare being a right, while constantly evolving, as any legislation around healthcare should, to respond to the changing needs of our 351 cities and towns. Too often in the debate about healthcare, we focus solely on the cost of healthcare while forgetting about that care component. We tally up costs without a focus on the ways in which that cost has precluded some from accessing care. We pretend that the cost of a single-payer system would be too expensive because we don't take into account the cost borne by the uninsured and the underinsured. Counselors, I know that you are all deeply rooted in your communities, and I wonder how many of you tonight have had constituents in your districts reach out who need care but can't afford it. Worse, how many of you have constituents listening at home tonight who have healthcare issues that could have been prevented if our state, instead of continuing to support a bloated healthcare system that focuses on profits, had instead invested in social determinants of health? This year alone, despite the fact that healthcare spending is down, the Health Policy Commission reports that insurance premiums will go up 8%. This is at a time of economic pain that is so very pronounced. A single-payer system will allow us to restructure our budgets so that instead of asking our constituents to increase their healthcare spending, we could instead redirect those funds to housing, food insecurity, and education. Sadly, Springfield passing this resolution this evening will not immediately change this situation. I wish that that were not true. Changes to the healthcare system just won't happen overnight. This is and will continue to be a long and hard-fought battle that requires us to put the common good before all special interests. And as we see time and time again, that's just never as easy as it should be. It will, however, mean that Springfield is joining the many communities that have passed resolutions in support of single-payer healthcare. It will signal to the state that Springfield stands with the people who believe that healthcare is a right, not a privilege, and that unaffordable healthcare is in fact not healthcare at all. I hope you will take the opportunity this evening to vote in favor of this resolution and to join us in the conversation about how we create the very best single-payer healthcare system possible for the people of Springfield and the entire Commonwealth. Thank you so much for allowing me to speak this evening. It was a true pleasure.
Thank you, Representative. Dr. Berwick, can you please state your name and address for the record?
Yes, thank you, Mr. President, and thank you, Councilor Letterman, for inviting me. I'm Donald Berwick. I'm a pediatrician. I live at 131 Lake Avenue in Newton, Massachusetts. As you heard, I also served in the Obama administration as the administrator of the Centers for Medicare and Medicaid Services, and I'm the founding chief executive officer and now senior fellow at the Institute for Healthcare Improvement, and I'm on the faculty at Harvard Medical School. I did run for the Democratic nomination for governor in 2013 and 14, and in that platform, I began to favor a single-payer system, essentially a public insurance system over the fragmented private one we have. I still feel the same. I know the public is not with us at this moment at a national level, but the opportunity does exist for a state to step out and show the way. There's authority under the Affordable Care Act for a state to decide to change payment in that direction. Massachusetts is, of course, a leader. We're a state that committed over 15 years ago to expanding coverage to almost every citizen of the state, and we've done very well. Nonetheless, we have to look, as Representative Sabadosa said, at some of the gaps we have in our healthcare in our state and in our country. There are 4 areas of concern that I constantly carry in mind. One is the completeness of coverage. Healthcare is a human right. In every other country, every other developed country on earth, not in this country, we leave 30 million people out. And you heard comments from Representative Letterman, Councilor Letterman, about the fragility of the healthcare system, the way we currently fund it. People can get left out, and they do get left out. The COVID-19 pandemic has only been the most recent case of that. We have a patchwork coverage, even in this state, creating a level of insecurity and burden of cost on people that people are finding it very hard to bear. Costs have soared in this state, and it makes it hard for people to find the coverage and care that they want. Quality of care is a problem. We take, for example, the opioid epidemic. We do not have a mobilized health sector ready to deal with and end this terribly tragic opioid epidemic that preceded the COVID epidemic. You heard about the problems of asthma in communities like yours. We don't have a way in this country or in this state to concentrate energies to solve the problems that afflict our populations with respect to health. We can't organize care systematically the way we probably could if we had a simpler system. We have problems of social determinants of health that Representative Sabadosa spoke to. There's no mystery about that. What it means is that healthcare doesn't create health. Healthcare is a repair shop. Health is created by circumstances in communities. There are 5 basic areas of social determinants. Here they are. It's the experiences of early childhood, which determine adult health at a level that is stunning. What stresses in early childhood produce defects and problems in health in adults. The second is the education system. A strong and well-supported education system with equity and real investment in children produce populations that are far healthier. The third is workplace circumstances, investing in a workforce with a more than a minimum wage, with a wage compatible with really robust life, and protecting people in the workforce from hazards and giving meaning in work. The fourth area is elder care, supports to elders so they're not lonely or isolated, can participate in society. And the fifth area is community infrastructures, which we're well acquainted with in the state. Defects in transportation systems, food security, housing security, recreational opportunities, violence prevention, criminal justice. These are all ambient factors in communities that actually determine the health of communities, far more than health care does. If we really want a healthy Commonwealth or a healthy nation, we have to find ways to get resources into the social determinants of health, but we don't. We don't have the money. Healthcare takes all the money, all the resources, time and again. And in Massachusetts, it's particularly egregious because we are among the most expensive states in the nation per capita. We were number 1 until a couple of years ago. Then we became number 2 and Alaska passed us. But we in this Commonwealth, it place enormous amounts of money in the healthcare system, far more than any other country does and much more than many other states do. And there is no evidence whatsoever that these very, very large and fast increasing investments in healthcare produce better health. In fact, there's evidence that they probably do not. So what about the payment system? In a fragmented payment system with all sorts of different flows of money, many insurers involved, confusing forms of billing and record keeping, it's really hard to tackle those 4 problems: complete coverage, quality of care, social determinants, and cost reduction. A single payer system of some sort at a national level would be national health insurance, at a state level would be some form of state health insurance, which covers everybody, immediately gives us leverage on all 4. By definition, it's universal. The way we write such a law could say that just by being in this state, you have healthcare coverage under terms we want to write that people can find acceptable and able to meet their needs. Coverage is solved in a universal health coverage system by definition. Second, for quality of care, if we have a single payment system, it can set goals for the Commonwealth. We could have decided with a single payer system to end the opioid epidemic altogether, all at once, everybody involved, all hands on deck. Not a decision we can make in a fragmented payment system. We could decide to deal with the problems, say, of asthma that Representative Letterman was talking about, or anything else we choose to do. We could have organized an approach to the COVID-19 problem that would make sense all across the state, coordinating with solidarity, with a sense of direction and strategy that is not achievable easily, if at all, in a multiple payment system. We could focus on social determinants of health. There are hungry children in this state. There are people without homes. There are people who have trouble finding opportunities to develop their skills in our schools. We have no way whatsoever, no way at all, to transfer resources from a very, very expensive healthcare system to investment in the things that actually make health. And so we keep running a repair shop instead of working upstream. A single payer system gives us an opportunity as a community with solidarity, with caring about each other, to move resources around and invest in real health. And finally, cost. A single payer system would be dramatically lower cost for this Commonwealth. That's money right out of the pocket of workers, right out of government's opportunities to invest in roads and schools and food security and transportation. That money is wasted in a complex system. The biggest form of waste is simply paperwork and administrative complexity, estimated to be at the national level something around $300 to $400 billion a year just to manage paperwork that virtually disappears in a single payer system. There's also the opportunity to work as a buyer, because a single payer system has much more negotiation leverage to get prices down instead of the opacity and the difficulty tracing money that we do in a complex system. It isn't easy. I've looked very, very hard at this. There are a lot of hurdles to accomplishing this at the national level, political and technical, and at the state level, both political and technical. But I think this resolution speaks to something that might really help our state. I don't want to claim it's the only way to make healthcare better. We need to work at that in every way we can under the current circumstances. But if you wanted a real courageous solution, a solution that would help us have universality, better quality of care, investments in social determinants of health, and lower cost, I just don't see a straighter shot than coming up with a single insurance system for the entire Commonwealth. Thank you very much for the chance to share thoughts with you, and if there are questions, I'll be happy to take them.
Thank you, Dr. Berwick. Councilor Brown, I see your hand is raised, followed by Councilor Whitfield.
Thank you, Mr. President. First, I want to commend my colleague, Councilor Letterman, on the work that he's done with the resolution, and I'd like to be added as a co-sponsor. I also would like to thank my colleague in the State House, Rep. Sabadosa. She has been excellent as far as soon as she's gotten there. It's been an honor to work with her as far as being State Rep. Bud Williams, Chief of Staff. I know Rep. Sabadosa, you might not hear it. I don't know if you do or you don't, but I want to thank you for all the work that you've been doing. You've really came in the State House and you've taken on a lot of issues. You hit the ground running, and I definitely thank you for all the work that you've done.
Thank you, Councilor Brown. If we could add Councilor Brown as a co-sponsor to this resolve, it'd be greatly appreciated, Madam Clerk. Councilor Whitfield, followed by Councilor Williams.
Thank you, Mr. President. First, I want to thank my colleague, Councilor Letterman, for drafting the resolution and adding me as a co-sponsor. I truly appreciate it. I want to thank State Rep. Lindsay Sabadosa for all you do. I know it's budget week, and I know you must be exhausted, and you still hung in there with us for this long meeting and eloquently spoke about the bill. And thank you. You always put forth meaningful bills, and I really appreciated the event that we were at together, that we spoke at together. We complimented each other well, and I really appreciate all you do. And Dr. Berwick, thank you so much. I was telling State Rep. Sabadosa in the chat that you're a genius, and she said it's probably because you get a lot more sleep than us. But I don't know that that's true, because you're here and you're there and you're all over the place. So I don't know that you're getting any sleep, but I know that I really appreciate it. I just wanted to tell one quick story. I was on a Zoom today that Maura Healey, Attorney General Maura Healey had about the same topic, and there was an infectious disease doctor that was on the line from South Shore, and she was saying that there are patients that have infectious diseases, but because they don't have health care, they come in really, really late, and the infectious diseases are, so far gone that she can't really save them at that point. But if they had health insurance, that they could come in earlier and be seen earlier and maybe prevent death. And so, a lot of stories on that Zoom really touched me, and I have family members that didn't have health insurance and couldn't get the health care that they needed, and maybe passed earlier than they needed to because their diagnoses were so far along. And so I appreciate everything that you all are doing, and Councilor Letterman for creating the resolution, and I definitely support it, and thank you for all your hard work and everything that you're educating us on. So have a great night.
Thank you, Councilor Whitfield. Councilor Williams, followed by Councilor Allen.
Thank you, Mr. President. I also want to thank my colleague, Councilor Letterman, for raising this to the forefront, as well as Rep. Sabadosa. I hope you're holding my Uncle Bud accountable in the State House. Please let me know how that's going. And of course, I'm certainly impartial to my friend, Dr. Don Berwick, certainly a man who ran one of the most impassioned campaigns for governor that I've certainly been a part of and can remember. And one of the quotes as he was speaking, something came to mind, and on the campaign trail, he had a quote that he often recited, and I think it's quite appropriate to mention that this evening as well. If you would just allow me that little bit of time. It says, it was once said that the moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. And that was recited by Hubert Humphrey. And, just imagine a system and a state specifically related, of course, to healthcare, where from the point of that child being born to the point where they leave this world, they are covered by healthcare and don't have to trying to get past the red tape that often limits folks from ever accessing it and getting the quality of care they need to live a full life. And so I certainly agree with the sentiments of this resolution. I know there's more work to be done in the State House to get this passed, as well as, of course, getting the buy-in from, the House, of course, and the Senate. So, again, I really want to thank those who are involved in raising this up. It's been single payer. I mean, I know other countries, I believe Canada, if I'm not mistaken, has some form of this as well. And it's something that we should be modeling here in Massachusetts. And we've been the leader in a lot of things, such as, gay marriage and, things like that of that nature. And this is something we should be carrying the torch on as well. So I just want to thank you all for joining the call and staying as late as you did to get those words across.
Thank you, Councilor Williams, Councilor Allen, followed by Councilor Finn.
Thanks, Mr. President. And thanks to everybody who has come here tonight and to speak on this. I have some other things to say than what's been said so far, and I don't want to be a naysayer because that's not how I am, but I feel bombarded tonight with information. It feels somewhat unfair in how the information has been passed because I wasn't really aware of this being on the agenda like it is. And it's certainly, the speakers have been great. Mr. Berwick, I remember your campaign for governor. Lindsay, I'm somewhat familiar with the Northampton, et cetera. But I'm cautious. I just putting up the caution flag to not be just jump on the bandwagon because it all sounds great, because it does all sound great. And believe me, not at the risk of grossing anybody out, there's nobody needs dental work more than me right now. You can see if you look. I'm missing a tooth, and I'm in the middle of I have two estimates. And I'm afraid to look at them. I was at my dentist today. I haven't opened his estimate. I think it's going to be $20,000 between the two things. So luckily, I might be in a situation where I could take that on, but I'm not taking it on right away. I just feel that a lot of good things have been said. The stories in public speak out were great, et cetera. But I want balance. I want to hear the other side. And my state rep, Angelo Puplo, I didn't see his name on there. I'd like to talk to him. I'd like to see, it's the heart-rendering stories are tremendous. But in government, as we all know, we have to be rational and look at cost and all that other stuff. And I know that this was supposed to say, I heard it would save $42 million, et cetera. I also know that we just got a president elected who was against Medicare for all. And not against it, but he was I don't want to say against it, but he was more into incremental improvements to Obamacare. So I have so many questions here. I've been writing them down. I don't like being the wet blanket, but I got to ask these questions, and I'm not sure I want to ask them here because we'll be here till 10 anyway with the police contract coming up behind us. I expect that to go long. So I'm just looking for balance, and I'm looking for an opportunity to find out more about this and not just go with the emotional response, which I want to have. And I believe the stories are terrible that people go through. But I also don't want to think that if I vote yes on this resolution tonight, that those stories are going to change tomorrow. We need compelling work and not just resolutions. And I know people are doing that. I know, Lindsay, you're doing that and stuff, and that there's work behind this. But I don't understand the relationship of this to Medicare for All on a national level. I don't understand the comparison of this to Obamacare, which people have taken to the Supreme Court. So I'm just looking for balance and fair play on this. And I don't have enough info. So I would like to make a motion to put this in committee so we could have a good discussion on it and have other people, members of our delegation besides Lindsay, come and talk about it so we can all be informed on it. So I'm making a motion to committee.
So Councilor Allen has made a motion to committee. Is there a second to that motion?
Second.
Seconded by Councilor Fenton. Is there any discussion on the motion? Councilor Fenton, I still see your hand raised, followed by Councilor Davila.
Thanks, Mr. President. I believe healthcare is a human right. I believe in the aspiration of a single-payer healthcare system. I think as everybody on the Zoom tonight can see, the Springfield City Council is not expert in those issues. We are expert, aspire to be expert in things like COVID response grants and private work. And so I appreciate the enthusiasm. I am not being asked about healthcare as a human right or the aspiration of a single payer system. As I read this resolution, I'm being asked specifically to endorse what from my limited understanding is a very complicated statute that Ms. Sabadosa has intelligently put together. And I wouldn't be doing anybody justice if I said that I enthusiastically support it, because candidly, I'm not smart enough on the subject to understand it. So for that reason, I support the move to committee. That's all.
Thank you, Councilor Fenton. Councilor Davila on the motion.
Thank you, Mr. President. Before I speak on the motion itself, I just like to say briefly, Dr. Berwick, it's a pleasure to see you, sir. I was first exposed to Medicare for All under your campaign in 2016, which I proudly participated. Mr. President, I'm gonna be blunt. I will vehemently and fiercely oppose sending this to committee. Why? I cannot understand how the United States, the richest country in the history of the world, cannot provide at the very minimum basic health care to its citizens. I do not understand that. We should be able to provide health care for every individual in this country. That's aside from the $42 million that we're going to be saving here in Springfield, as Rep. Sabadosa has stated. And I believe Dr. Berwick pointed out to it. We tend to put red flags on this kind of proposal. But there's many other programs that are kind of similar to this in ways Social Security and the VA system, which has shown that they work fairly well throughout the years and do become a safety net to people. I see Medicare for All as a safety net. We should not, healthcare is not a product, it's a human right, like Councilor Fenton stated. So with that being said, I won't beat the drum much more because my colleagues have more eloquently than me stated why we should vote for this and pass this resolution. I want Springfield to be in the forefront of this, and so I will probably be supporting this and voting against Senator Finley. Thank you, Mr. President.
Thank you, Councilor Davila. There's a motion made on the floor by Councilor Allen, seconded by Councilor Fenton. Councilor Letterman on the motion.
Thank you very much, Mr. President. I can certainly appreciate Councilor Allen and Councilor Fenton's comments relative to feeling bombarded. I'm sorry that Counselor Allen, you feel that way. Certainly I'm very thankful to the Massachusetts Mass Care Coalition for really spending time to reach out to our constituents and who have been members of their association and who have been advocating in their role as residents for this type of legislation. And I'm grateful that they took the time tonight to come out and speak with us. Certainly the agenda came out last week. And I want all my colleagues to know that, I think one of the biggest pieces is please don't ever hesitate to give me a call to talk about anything that I sponsor on the agenda. I'm always available to answer those types of questions. But I think that one of the important things that was said here tonight was by Representative Sabadosa, which is that the two bills that currently exist in the Massachusetts legislature are aspirational and constantly evolving. And so to the regard that we are not going to solve the issues of the challenges that exist in our healthcare system here tonight on this Zoom call, we are also not going to solve those problems in a committee meeting about a resolution. I think that what the resolution, in my view and my intent in bringing it forward, and I think that in the language, shows that we support the movement in the Massachusetts legislature that is occurring and has been occurring for many years towards an eventual solution to the issues that we are talking about here today. And it allows us to join with counselors that have sponsored similar resolutions across the Commonwealth to encourage the legislature to keep having those conversations. Certainly the legislature, the state legislature, although we appreciate Rep. Sabadosa and Dr. Berwick spending some time with us on a city council meeting here tonight where the real work gets done, but they also have a process where their real work gets done too, through their committee hearings and those sorts of things. So were these bills to move, they would go through an extraordinarily scrutinous legislative process where many, I think, of these conversations could happen. But with that said, this is a bill that's been around for quite a while. I think that, in my view, if we support the aspirational nature of the bills, we should be comfortable passing a resolution of this nature. And so with great respect and deference to my colleagues, I would oppose a move to committee. I would encourage us to vote down that move to committee and to pass this resolution this evening and join the other communities that have gone on record essentially in support of single-payer healthcare, because as single-payer universal healthcare exists as a proposal in Massachusetts, it exists in the form of these two bills. And it's really quite as simple as that, in my estimation.
Thank you, Councilor Letterman. So there's a motion on the floor to send this item to committee made by Councilor Allen, seconded by Councilor Fenton. Madam Clerk, Councilor Brown, I think you're sharing your screen. I don't know if Focus did that purposefully. Madam Clerk, can you please call the roll on sending this item to committee? Sorry.
Did I didn't mean to do it. Did you fix it?
Yeah, it's fixed.
Sorry, Mr. President.
Madam Clerk, if you could please call the roll on sending this item to committee.
On sending item number 23 to committee, Counselor Gomez?
No.
No. Counselor Whitfield?
No.
No. Counselor Davila?
No.
No. Counselor Fenton?
Yes.
Yes. Counselor Curran?
No.
No. Counselor Ramos?
No.
No. Counselor Walsh absent. Counselor Williams?
No.
No. Counselor Allen?
Yes.
Yes. Counselor Letterman?
No.
No. Counselor Edwards?
No.
No. Counselor Brown?
No.
No. Counselor Hurst?
Yes.
Motion fails.
Motion fails. Councilor Gomez on the resolve.
Thank you so much, Mr. President. I just want to thank everyone for their comments. I want to thank Mr. Berwick and Rep. Sabadosa. This is something that I truly and mostly really do wholeheartedly support. For the most part, people want to believe in something. We've seen this over and time again when it comes to issues when we're asked to step to the plate and really, like my colleague stated, we're not going to get all the answers now, right? But for the first time ever, you know, and what this body has done and consistently done is led the conversation and supported things when it wasn't sexy, right? When it wasn't the right time. And it's never the wrong time to lead, to have this conversation and to actually open it up to show that our legislators that have supported it, like our state senator, Eric Lesser, like representatives Bud Williams, representatives Carlos Gonzalez, representatives Brian Ash, you know, and also even my predecessor, Senator Jim Welch. There has been a lot of representatives and senators here that represent the city of Springfield that have supported this. And I myself endorsed this during my candidacy as the next state senator of the Hampden District. And I think what entails and what brings forth is issues such as this when it comes to healthcare, like myself that suffers from pre-existing conditions. When I go and get, and I can only speak for myself, when I go and get checked out for a certain issue that I have going on with my diabetes, and then it prolongs me trying to go figure it out because I can't afford the copayment. And I'm a city councilor that sits on this body with insurance. So it's disheartening that, you know, we're going to choose the, hey, you know, I don't think if we should do this or we shouldn't do it. And if you don't want to support it, I'm game to the fact that we've done this before. We've been here and said, just vote it down. And outside of that, we can move forward. And then from there, we can, you know, humbly, like we stated, have more opinions and more dialogue on this issue. I think for us to save face half the time, I think is concerning moving forward when it comes to the people that came out and voted for this and want to see candidates that do support this. So with that being said, and I've been quiet really the whole meeting, but this is something that is important to people, specifically the poorest county in Massachusetts that is suffering with people dying of homelessness and that are incarcerated and that are dying in disproportionate and not figuring out that if they should go to the emergency room or not because of a 150 copay that's going to figure out if they're going to eat or they're going to feed their children. With that being said, thank you for the support. Thank you, Jesse, Councilor Letterman, for putting this forward. For the most part, this is something that we need to put our foot down and draw a line in the sand so that at least we can have the conversation. Because if we keep on putting it on the back burner, more people are going to die. More people like my kids are going to suffer from health conditions when it comes to their respiratory. And then we're going to end up dealing with stuff like this. If you believe that the biomass is a problem in the city of Springfield, then vote this up and stop playing games. Thank you.
Thank you, Councilor Gomez. Councilor Williams.
Thank you, Mr. President. I just wanted to mention very briefly that, you know, there's certainly been correspondence circulating around the Medicare for All plan for about some time now. And we were actually provided a list of, I would say, just glancing at the list, over 30 unions. 30 unions, both regionally, locally, that support Medicare for All. So you're talking about our construction workers, you know, and if we you know, scream from the mountaintop that we support our unions, well, the representatives and the folks that make up these unions also support this for a reason, because they realize that access to healthcare, those that are part of that, you know, or sometimes struggle to gain access, those that are a part of the union. So again, I think it speaks volumes to the intention and also the vibrancy behind a resolution as such. So I would just encourage my colleagues, if for the name of union workers, if nothing else, to support it.
Thank you, Councilor Williams. Councilor Finn.
Thank you, Mr. President. I'm not trying to be a stick in the mud or playing the games. I guess my point is just that it's very specific about this bill, and I don't understand the bill. I get that the aspirational piece. I am going to say this, but before everybody goes crazy, it's okay. I can vote against it and sleep well tonight. It's not a big deal. But if it said that the city council supports the concept of universal health care and Medicare for all, and healthcare is a human right, and implores the state legislature to explore these two bills, fine. But it says we expressly endorse them, and then it says we're going to send it to the congressman and the governor and all these other people and tell them how emphatic we are for it. And others may be completely informed on the complexities of the general court and how that's working, but I'm just not. So I support the concepts. I want to thank everybody for putting their time into it. If somebody's interested in making that amendment, then that'll get my vote. If they're not, then that's okay. We can vote for it and I'll vote against it. That's all.
Thank you, Councilor Fenton. If there are no further hands raised in the queue, Councilor Letterman.
Thank you, Mr. President. Thank you to all our colleagues for the support this evening, and especially for the important dialogue and debate. I just wanted to make one correction. I mentioned the Mass Care Coalition, and the coalition that actually worked on turning out many of the speakers this evening was actually Western Mass Medicare for All. So I just wanted to make sure that I made that important correction.
Thank you, Councilor Letterman. Councilor Allen.
Thanks, Mr. President. I just put my hand up just for a quick comment about the way the world is making things binary. Yes or no, yes or no, Trump or Biden, Trump, 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 or whatever. Things have become very binary. And I think as elected officials, that we're, as much as we need to take principled views on conceptual things and some concrete things that go forward, it's also our job to be looking at the gray area and looking at not making things into yes, you voted for it, or no, you didn't, and making more of it than that. What Councilor Fenton just said conceptually was I thought a really good comment. Hadn't thought about saying that, but you know, we have to be really careful in this world of where there's not enough compromise. There's not enough talk. I tried for committee. We didn't get committee. Where we could have talked about these things. I'm not sure I understand the urgency of this for tonight, but apparently 9 people did. So I don't want to be mad. I don't want to be scapegoated. I don't want any of that. I just want to vote the way I want to vote and let it be. And I made my statements about what I thought would be a better way to do this. And so there was more balanced information on the other side. And I asked for that. It didn't come. It didn't get voted for. So please don't make the world binary. It's bad when it's binary. It's just you're right or you're wrong. We have to be very careful about that. Thank you.
Thank you, Councilor Allen. Thank you, Councilor Allen. Councilor Gomez, I see a hand raised in the queue.
Thank you so much. Appreciate it, Mr. President. And I'll be brief. I think that to be quite frankly, I think that Councilor Allen does has a point, you know, when it comes to a lot of things that, you know, need to be, you know, spoken about, diluted. But, you know, when it comes to certain things that certain people support or colleagues or individuals, you know, passion comes out and it gets put on the front line. You know, and outside of that, I think that, you know, because certain individuals are more passionate about a subject and probably are probably a little bit more versed, you know, it shouldn't be felt like as an attack, you know, and if anybody feels attacked because they have a difference in opinion, myself, you know, and anybody else, I feel that, you know, I apologize if that's what it was, but for the most part, you know, that's not what's intended. With that being said, you know, like I said, easily because it's getting late, and that's the way what I said was, we can, like what we simply stated was we're going to vote it up or we're going to vote it down, and you know, we moved on to the next process. It almost got sent to, it could have been sent to committee, but it wasn't. If there's not an amendment that's going to be made, so you know, Councilor Fenton can feel comfortable with it, which is totally all right as well. But for the most part, it's just so we can get business going on. You know, that's why I said just vote it up or vote it down, and then from there we can, you know, commence and work on our next agenda item. For that being said, you know, respectfully, thank you for the time and thank you for the opportunity just to speak on this, and then and that's all I have to say about that.
Thank you, Councilor Gomez. Madam Clerk, can you please call the roll on sending this, on this, approving this resolve, please?
On approving item number 23, Councilor Gomez.
Yes.
Yes. Councilor Whitfield.
Yes.
Yes. Councilor Davila.
Yes.
Yes. Councilor Fenton.
No.
No. Councilor Curran.
Yes.
Yes. Counselor Ramos?
Yes.
Yes. Counselor Walsh absent. Counselor Williams?
Yes.
Yes. Counselor Allen?
No.
No. Counselor Letterman?
Yes.
Yes. Counselor Edwards?
Yes.
Yes. Counselor Brown?
Yes.
Yes. Counselor Hurst?
Yes, the resolve is approved. Madam Clerk, can you please call the next item on the agenda?
The next item on the agenda is item 24. It's the collective bargaining agreement ratification.
So I know this was added late. My apologies. If there's an objection to us hearing this, I know it should have been under unfinished business, and I neglected to pick that up when the first agenda came out. So if there is an objection, we will not hear this item tonight. But my hope is that we will be able to hear it, because Councilor Ramos had every intention on bringing this out, and it was really, it did not make it. It was my oversight. So if there's no objections, we will entertain the collective bargaining agreement ratification, item number 24. Thank you. Is there anyone present to speak to this item?
Bill Mahoney.
Floor is yours.
Good evening, councilors. Thank you for the time to discuss this. As you're aware, this came up once already in front of the council. We've had two public safety subcommittee meetings where we've discussed the tentative agreement at length. This was a TEA that was reached on September 4th of 2020. Negotiations began on February 5th of 2020. The police supervisors represent the sergeants, lieutenants, and captains in the Springfield Police Department, and their last contract expired on June 30th of 2020. This is a one-year agreement that would go from July 1st, 2020 to June 30th of 2021. There's a 1.5% COLA that would be effective and retroactive to July 1 of 2020. There's two changes of significance in this. One is we would do an expansion of the period of time to bring interdepartmental charges against a member of the bargaining unit from 90 days to 120 days. We certainly, in the administration, would like to see that expanded from 90 to 120. And the second piece of this, which we've discussed at length in the subcommittees, was adding an assessment center to the way that we do our civil service for police captains.
I think you broke up.
Did you hear?
Can you repeat the last part again? I'm sorry. I think you broke up on us.
All right. The last part was we've added in an assessment center to the way we are testing for police captains in the Springfield Police Department. The captain is the highest rank in that bargaining unit. It's just below the rank of deputy chief. And we thought it would be beneficial to the city to have an assessment center in addition to the Massachusetts Civil Service test. So we'll bring in an outside assessment company to do this examination of the police captain candidates as we go through the civil service testing process.
Thank you. Are there any questions or comments? Councilor Ramos, the floor is yours.
Thank you, Mr. President. It's been a long night. We've been here for just over 3 hours now, and so I will try to limit my comments, although I do have a lot to say. I'll try to pick and choose what I think is important to this conversation. First of all, we did hold 2 subcommittee meetings on this issue. I want to thank Attorney Mahoney for attending both of those subcommittee meetings and for giving us the information that we were looking for. Mr. President, I'll be honest, when I first read the contract, or the proposed contract, I chuckled. I chuckled at the audacity of the administration and the supervisors union and the commissioner to propose this to the city council during a time that we're in the middle of a national movement for police reform. And after receiving a scathing 27-page Department of Justice report that specifically mentioned one of the issues that I have with this proposed contract, and then they somehow to attempt to pass it off as meaningful reform. I thought that was insulting. And I'm referring, of course, to the section 5.02, which reads in part that all departmental charges against a unit member shall be initiated no later than 90 days following the alleged offense. The proposal before us tonight extends that time frame to 120 days. You've all heard me describe this as a statute of limitations, because it is. It's basically a statute of limitations because it would limit the public's ability to file complaints against police officers for non-criminal offenses. By comparison, if you compare that language to other municipalities, and I mentioned this in subcommittee, with the help of the Massachusetts Municipal Association, I was able to confirm that we are the only municipality in the Commonwealth of Massachusetts that has this language in a collective bargaining agreement for police officers, either for supervisors or for patrolmen. And we're the only ones that have a statute of limitations that begins from the date of the incident. And I'll be more specific here, where what they provided for me was a brief survey of comparable municipalities, where New Bedford, no similar language, Northampton, no similar language, Pittsfield, no language, Worcester, no language. They don't have any language in their contracts that refer to the timeline in which someone can file a complaint against a police officer, or in which the department can bring charges against a police officer for non-criminal complaints. Chicopee and West Springfield are the only two that are close, not necessarily in population, but they're close in terms of geographically and proximity. And they actually do have language, and they're the only two other municipalities that have this language in their contract. And I'll read it out loud so I can explain the differences between what they have in the contract and what we have before us tonight. So Chicopee's contract reads, in all departmental charges, i.e. non-criminal, against an employee shall be initiated no later than 60 days following the alleged offense or from the day in which the employer became aware of said offense. West Springfield, identical. All departmental charges, i.e. non-criminal, against an employee shall be initiated no later than 60 days following the alleged offense or from the date upon which the employer became aware of said offense. Our collective bargaining agreement for the patrolman does state that the clock starts at the time that the department learns of the incident. There was a recent letter to the editor that was written by Lamar Cook, who's a well-respected member of our community, and the title of his letter to the editor was, "The public's ability to file complaints against police officers should not be limited." And in that letter, he wrote that the Black community is tired of being talked down to as if we are unable to detect a policy that is dangerous for our community. Our current police commissioner cannot, in good faith, claim to push for comprehensive police reform and in the same breath support a contract that limits the public's ability to file complaints against rogue police officers. Limiting the public's ability to file complaints is essentially a step backwards in the fight for comprehensive police reform. Now, I want to mention some of the arguments that I've heard both at the first meeting and in committee, because I only plan on speaking once this evening. We've been here long enough. I don't want to back and forth. So I'm going to address some of those arguments right off the bat. Look, what I've heard is the city of Springfield has done enough in terms of police reform. This statement is an insult to all the victims of police misconduct. We have not nearly done enough to protect the public from police misconduct, and we have to continue pressing for police reform because what we have done is not enough. I've heard in committee that the last sentence of section 5.02 essentially gives the city an out because it states that we would, quote, have the burden to prove that such delay was caused by circumstances beyond the control of the department. So in other words, end quote. And so in other words, that would give us an opportunity to go beyond the 90 days or 120 days or whatever it is they're proposing. So then the question is, why the extra hurdle? I mean, if we can go beyond the 120 days, then why even put that in the contract? Why not just spell it out outright? Why not just write it as is written in the Patrolmen's Union's contract, which is that the clock starts for the date that the department learns of the incident? In fact, why have this language in the contract at all? Like I said, there are, out of the 351 cities and towns in the Commonwealth of Massachusetts, there are only 2 other communities that have this type of language. And Springfield is the only one that starts the clock at the time of the incident, the only one. Chicopee and West Springfield have a shorter time frame, but again, theirs starts from the date in which the department learns of the incident, similar to what we have written in the patrolman's contract. The other argument that I heard is we may not get what we want in the contract this time, but we can get it in the contract next time. That argument doesn't hold any weight. I'm going to presume that I'm the only counselor that has ever been had a seat at the bargaining table, and during the collective bargaining process. I'm pretty familiar with the way that this process works. And one thing that I can tell you for sure is this: does anybody know what the number one thing that an arbitrator takes into consideration when he makes a decision? The number one thing that an arbitrator considers:
money.
Past practice. Past practice. Construction trades, including the union that I belong to, we've been awarded the rights to certain types of work and to claim certain types of work based on past practice. No other explanation other than past practice. In fact, the city of Springfield, we lost an arbitration in 2014 to the Patrolmen's Union in arbitration related to the funding of the Quinn Bill. And the reason why that decision was made was based on past practice. The arbitrator was not going to rule against the Patrolmen's Union because the city of Springfield had elected to continue paying the Quinn Bill, despite the fact that the governor made changes to the city to have that obligation. And because we continued to voluntarily pay for the Quinn Bill, and that was past practice, we were obligated to continue paying for the Quinn Bill. So it's almost impossible to remove something from a collective bargaining agreement once it's approved. This is not an easy change. We're not going to be able to get it, change it in the next contract. It's not guaranteed. Those things don't happen, and it certainly won't happen unless we pay a heavy price for it. And I'm talking about finances. And finally, the argument that we've heard over and over is that the city's been in regular contact in communication with the DOJ, and we're told in committee that the Department of Justice is, quote, satisfied with the proposal, but yeah, we haven't seen any evidence of that. We haven't received any written communication from the DOJ that says that they're okay with this type of language. So I don't think that holds anyway. And to be honest with you, I'm not satisfied with the administration's effort on the issue of police reform. On June 9th, we all stood in front of City Hall on the steps together, and we made 4 very specific recommendations as to how the city should address, improve, and change the use of force policy for the Springfield Police Department. Since then, only one of those recommendations has been implemented. Almost a month later, on July 8th, the Department of Justice released the 27-page report with 4 very specific recommendations, none of which have been fully implemented to date. So I'm not happy at all with the city's urgency, with the administration's efforts in achieving meaningful police reform. So in conclusion, Mr. President, I'm going to say that we're living in historic times. So this year, and not just locally, but nationally, and the year 2020 is going to be remembered for two things. Number one, for this pandemic. And number two, this was the year of police reform. This is the year where people actually realized that there's something wrong with the way that police certain communities, and that maybe that needs to change. And we're part of that history. We're in a position to be able to actually make that change. One day, we're gonna tell this story to our children and our grandchildren. And this is our moment. This is our movement, right? This is the year that we stood up and said, that's enough. It's enough with the way that Black people are treated in our country. And we've had enough with the way that certain communities are targeted by rogue police officers without being held accountable. And we're gonna show our children those photos of us standing in front of City Hall together. And we're gonna say, that was me standing up for what was right. And we wanna be able to tell them that we were on the right side of history. I wanna be able to tell my daughter that I was on the right side of history, that I fought for what I believed was right, and that I fought to make meaningful change in our city. And we can't do that in good conscience if we allow this contract to go through as it's written. It limits the public's ability to file complaints. That's a step backwards. That's not reform. So I'm asking you all to please make the right decision and stop approving policies that protect officers who break the law. And let's be on the right side of history. You know, it's time to send a very clear message that we've heard all of those people who have marched our streets and demanded police reform. We've heard you, and we're going to take action, and we're going to make it happen. So I urge all of my colleagues to vote this contract down, send it back to the negotiating table, come back with a proposal that is much more reasonable, that doesn't limit the public's ability to file complaints, that doesn't start the clock at the time of the incident, and then we can talk.
Thank you, Councilor Ramos. Councilor Brown.
Yes, I'll be brief. I want to agree with my colleague, Councilor Ramos. I do believe that it is something that we still should revisit. When you look at the police force, I'm looking for them to, first of all, show good faith. At one point, they're saying we're saying, hey, you know, we're the DOJ. We're doing everything we need to do. We're improving. I do recall that we still haven't fixed the facts of the deputy chiefs and the other individuals not living in our area. I'm still waiting for that to occur. We have Black and brown individuals who live in Springfield who, you know, would love to have those positions. I'd be remiss to not mention the fact how I personally watch people of color, my father being one of them, overlooked plenty of times throughout his career, and it was unfairly overlooked. I'm sure people who know him. So when it comes to the police department, I'm a police kid. I support.
You can't put that on right now. You got to go to bed.
Oh, my bad. I support the police. 100%. I believe we need resources, but I also think that they have to be more transparent. I mentioned it before. I've looked into certain areas where they actually had the police records as public information, where I believe the city council and the city, they actually did something where now it's public records. We pay we pay taxes for their actual for them. So I just, so it's something where I'm still looking for the police to give a little bit more, be a little bit more transparent. And in this particular case, like I said, I'm still looking for them to address certain issues that they haven't addressed yet. So I do agree with my colleague, Councilor Ramos. I believe that we should look at it a little bit more. I think they should take it back and just look at it a little bit better. Thank you.
Thank you, Councilor Brown. Councilor Gomez.
Thank you, Mr. President. No, very briefly, the only thing that I have a problem with this contract is the time frame and, that statute of limitations, which I think is a real problem. Not saying that, this specific union doesn't deserve a contract, but specific things during the temperature at the moment and, what, the constituency and also, the city of Springfield as colleagues, or as counselors, I think that we're looking for. I think that this is not a back and forth that we don't support our police officers, specifically this union. But I think that sometimes with underlining things of this nature, which stipulated in this contract, leaves room for if any of these individuals and something had come to light while they were younger officers, it can't come. Basically, it just leaves room, and I hate to use this as an analogy, which I don't, but it just leaves into room what we had felt when we fell victim with trying to prosecute, Bigda. So just with that,
Counselors, I gotta caution you not to use the name of any employees, please. Okay, you're gonna have an open meeting.
I apologize. Then I apologize. I didn't mean to use that. I refrained from using that. But it just refrains from, folks that probably did something that didn't come to light, and they just get away with it. And I think that accountability is what it's about. And this is just a step forward. I think that, transparency and just a little bit of a leeway when it comes to that time frame is what, I think the constituency and, we don't bargain the contract, but that's the only discomfort that I have specific to the contract is that time frame. The rest of it, I really don't have too much to say. I think everything else is sound.
Thank you, Councilor Gomez. Councilor Whitfield.
Thank you, Mr. President. Bill, I just have a question. Was there any other time frame? Are you at liberty to say if there was any other time frame that was negotiated besides the 120 days? Like, did you start at a different point, or was that offered initially? Oh, you're on mute if you're talking.
No, I believe we started, I believe the city started somewhere differently. It may have been just even a complete elimination of that language. And we settled on a compromise of this. And again, this is just a one-year contract, and we're back at the table probably in a month or two for the successor agreement. So we're just trying to get through the COVID year is really what we're doing with this contract, and probably with a number of our other contracts. And we're hoping that we'll have a better idea of what the finances look so we can bring you back more comprehensive contracts as we get further into the road. And again, just to address Councilor Ramos real quickly, remember, we did bring in, body worn cameras. We brought in light duty. We brought in residency. These are things we brought in just the last contract or so, or the last two contracts. We think, again, we're just trying to get through this 1 year is all we're doing with this contract.
Thank you.
Thank you, Mr. Mahoney. I don't want to, I thank you for addressing Councilor Ramos. I don't know if it was brought in or if it was fought for by the council, but we appreciate the body worn cameras. There's still a lot of work to do. There's a lot of reform to do. I thank Councilor Ramos for talking about 2014, something I didn't know about, setting the precedence and how a case was lost because of that. And so I would be nervous to support the 120-day rule just because if that's going to set the precedence of what we can do moving forward, that will be a bad one to set, especially if the time clock starts when Does it start, Bill, when the incident takes place or when it's reported?
So, the language in the contract says it starts within 90 days. That's your precedent. Your precedent is 90 days. That's what we own right now. And it starts within 90 days of the alleged offense. However, the next sentence reads, in the event that charges are initiated subsequent to 90 days, as set forth above, the city will have the burden to prove that such delay was caused by circumstances beyond the control of the department. And my position on that very clearly is, if we don't know about it because the complainant hasn't come forward in the 90 days, then we can still bring these charges forward. So that language is already in the contract. That language is staying in the contract. So if we, I like having 120 days. I think that's great to have a longer period of time. But keep in mind that if something comes in later than that, and we weren't aware of it, then we're going to bring the charges.
Is it we're going to bring the charges, or we could?
We're gonna bring the charges, and then we're gonna have to, if the employee is disciplined as a result of the charges and files a grievance and takes us to arbitration, the burden will shift back to the city to show, why did we bring the charges after 120 days? And we're gonna say to the arbitrator, well, because we didn't know about it until 150 days. And that's when we found out about it, that's when we investigated, and that's when we brought the charges. I think that is a very reasonable argument to make to an arbitrator, and I'm very comfortable with that argument.
Okay, I think I'm done with my questioning. Thank you, Bill.
Thank you, Councilor Whitfield. Councilor Davila, followed by Councilor Williams.
Thank you, Mr. President. I will be as brief as humanly possible on this subject. We have been through this a couple of times through the committee meetings, or even in this meeting. I do hear what Mr. Maloney is saying. My apologies, saying. Mr. Mahoney, thank you for your work on this and for facilitating yourself to us to answer questions. But I'm thinking that given the history that unfortunately our police department has had with the community, it will seem to me that we have very clear and concise language that everybody understands. Because I have heard throughout this entire process conflicting information, and that in and of itself I have an issue with. And I don't know why that is. I don't know why that has happened. So it will seem to me that we have very clear and concise language. I believe Councilor Ramos a little while ago was alluding to contract language from, I believe it was Chicopee or Springfield. That seems to be very clear to me. Because I would hate to see a situation in which, one, there's some sort of a loophole. We have an officer or a supervisor who gets disciplined, then a criminal charge brought in. What is he going to be limited to further discipline? I believe that he might be, but that's one of my concerns. The other concern that I have with this language, sir, is that, Mr. President, I think it should be 90, 120 days, whatever it is across the board between supervisors and regular police officers. Another thing is this assessment center is not setting in well with me. Again, the commissioner said at the beginning of her tenure that she was pretty happy with the quality of her supervisors and the collective experience of her supervisors. So what has happened between that time that she first came on to now that all of a sudden we need to change this process? So I for that reason, because I have a lot of doubts, I'm not entirely clear, I will be not supporting this contract. And by the way, a lot of the changes that has happened, yes, they're critical. They're not a favor to us or to the community. Those are changes that have been demanded for years. And so there's a lot of work to do. Mr. President, the police department, I can tell you beautiful stories about the guys out there. Those guys are great. Those are really, really great guys. But we need to be clear. We need to be clear, we need to be concise as to what it is that we expect and what we want from the police department so that the good officers are protected. For those reasons, Mr. President, we are opposing these contracts. Thank you, Mr. President.
Thank you, Councilor Davila. Councilor Williams, followed by Councilor Fenton.
Thank you, Mr. President. I will also be brief on this, but in regards first to the assessment center, I also see this as a grand opportunity and interfacing with the chief diversity officer. The intention behind that piece of legislation was to work with the city, that individual work with the city to have benchmarks as it relates to things like this, in terms of promotion, especially to the higher ranks. So, it would be great, Mr. President as well, at some point, just to get an indication of what those benchmarks are as it relates to both, jobs that are fall with folks working within City Hall, but then outside of that as well. It'd be really great to know what work is being done in that area. And I would hope that that person would be working with in some context within this assessment center to make sure that folks who are of the protected classes, folks who are people of color, are also not being looked over and given the same opportunity that they so rightfully deserve, especially folks within the department currently. Also, in regards to the stipulation around the time, I understand that of course, for collective bargaining and, you're meeting in good faith, trying to reach an agreement. But what I don't understand is relative to Councilor Ramos's point around why is the language included anyway? Especially when you look around the state and see that it's left out and there's more liberality as it relates to, the absence of that language essentially. So, I'm worried about loopholes myself, to Councilor Davila's point. And I just want to make sure that it's made widely clear with special regard to what's happened in Springfield. And there's reports coming out every day about new things that are being unveiled. So the evidence is just not there. The evidence is not there that we can not necessarily that we can handle, but that folks can be trusted enough to do what needs to be done to bring charges when they're so rightfully deserved. So that is why I will not be voting up this contract. I think the folks need to go back to the drawing board and draw up something a little bit more, again, liberal and as it relates to that time frame. It is a statute of limitations that should not be present, as it is not in other places that, of course, are parallel and kind of, similar to Springfield's composition. So that's what I'll leave with. You're muted, Mr. President.
Sorry, thank you. Actually, I think you raised some great points with respect to our Chief Diversity Officer and Attorney G. Prior to COVID, she was supposed to present to the council in terms of a lot of the things that you just discussed. And once COVID hit, that did not happen. So I will circle back with Attorney G, who I'm sure is more than willing to come before the council at a committee of the whole meeting to kind of talk about what direction she's going in terms of diversity for the entire city. So I will, I'll get back to you on that one. Councilor Fenton, followed by Councilor Allen.
Thanks, Mr. President. I think that the 120-day thing is a little peculiar, but we have to be cognizant of the facts and circumstances. And I recall from the first committee meeting that Mr. Mahoney said, we've owned this language since the 90s. And so that's been the practice, the 90-day standard in the current language that we have. Is that right, Bill?
Yeah, at least the 90s. It might even go back to the 80s.
And so, the proposal is to improve it by expanding the period from 90 to 120. It's not everything the city hoped to get, but it's the best we could do based on the facts and circumstances. And so the way I look at it is, it's progress, and it's not everything that we'd like to have. No collective bargaining agreement would be fair if we got everything we wanted to have. But it's progress. And if we don't do it, if we vote it down, then what happens, Bill? Don't we just get stuck with the 90 days in the existing language until the next contract?
Yeah, so we'll go back to the bargaining table. The 90 days will continue to live in the contract until we reach another agreement with the union and come back to the city council with something down the road.
When is, you said that there's another contract coming up. So if we pass this contract, when would it be good until?
This contract would last until June 30th of 2021. So we'd have about 7 months left in the contract, but we'd start bargaining probably within a month or two.
So in practice, if we voted it down, we'd continue to have the existing language. We'd have the 90 days instead of the preferable 120 days. And then for all intents and purposes, you would probably just start negotiating for the next contract, wouldn't you?
Well, I mean, this could go a different route, and it could be if we can't just make a deal on this contract, it could end up in mediation and then arbitration in front of the Labor Management Committee.
All right. So given that, I'd like to see some progress rather than the outcome of very likely no progress if we vote it down. That's my 2 cents.
Thank you, Councilor Fenton, Councilor Allen, followed by Councilor Letterman.
Thanks, Mr. President. Thanks, Mr. President. Just trying to figure if I'm muted or not. I attended the 2 committee meetings that were held, and we were going over tonight a lot of what was said at those committee meetings, but I was impressed by Deputy Chief Kent, who was at those meetings. I see him listed here as on this Zoom call, and I think it would be only fair if we asked him to comment, representing the police department, on the assessment center and the 90, 120 days, and any other thoughts he has, if that's okay, Mr. President.
Absolutely. Can you please state your name and address for the record, Deputy Chief Kent?
Deputy Chief Kent, I'm at 559 Nassau Drive. Can you guys hear me okay? I'm using a new set of headphones here.
Yes, we can.
Okay. So speaking off the cuff here, and to Councilor Fenton's point, if in fact this doesn't go through tonight, we're at the 90 days. Nothing changes. We just keep going, going ahead as we have been since either the early 90s or the 80s with the 90-day rule. If we do pass it, we take a step in the right direction, I think, and we set a precedent going into the next round of negotiations, which starts in a couple months for the next contract, which would go into effect July 1st. And that's what I have to say about the 90 120 day rule. All right, it's not perfect. It's good. I would say, don't kill good chasing perfect. All right, we have more. There's more negotiations to come. There's another contract to come. We're trying to bridge the gap, get through COVID, and in the process, get ourselves an assessment center, which is going to set our police department up, I think, command staff-wise, for a heading into the future. The fact of the matter is that civil service tests are more about memorization than they are about skills. And the assessment center is the best practice. And for me, the main part about this whole contract is getting that assessment center in place, getting it in place for captains, and then eventually getting it in place for all supervisors, because it's a fairer practice. It's just a better practice, and it's something that I think. And we're going to end up there eventually, and I think the sooner the better, as far as I'm concerned. Thank you.
Thank you, Councilor Allen. Did you want to add anything to that, or?
I just appreciate Deputy Chief Kent being at the committee meetings and coming tonight, and I just think there's I like what he said, chasing the not trying to chase the perfect, and Councilor Fenton and I worked hard to get residency back when we got on the council. We worked hard to get residency back. We got it back. it was years of, and Mr. Mahoney could tell us about it because he's the guy that we were working with the hardest to get it in the contract. We've done that. We got the body cameras. There is incremental progress, and is it incremental enough or big enough? I don't know. Everybody has to answer that for themselves. But I think there's incremental progress, and I think there's absolute intention on the part of Deputy Chief Kent to keep working with us on it. And I don't know what his role is in the collective bargaining process, but he has been the rep of the police department in all these meetings, and he has consistently said the same thing with sincerity and resoluteness, in my opinion. Thank you.
Thank you, Councilor Allen. Councilor Letterman.
Thank you very much, Mr. President. Let me start by saying I don't think there's anybody on this body who doesn't agree that we need to pursue reforms in our police department. This body currently has a pending lawsuit seeking to justly, in our opinion, reorganize the leadership of the police department for many reasons. And that's an issue that the majority of members on this body have been working on for years, some before they got elected, others since they've gotten elected. And we've spent, quite a bit of time, myself and all of us, in coordinating that legislation and that action. So I think we're all committed to that. I'm really hearing the concerns of my colleagues. And so I think that the questions that I have are relative to kind of where we are and where we will go from here. I also am uncomfortable with the language that reads from the date of incident. I also want to see that language change to from the date of report. I think that the timeline in terms of the 120 days, 90 days, I want to understand that better, Attorney Mahoney. The timeline from that is currently 90 days and that is proposed to be extended to 120 days. This is the timeline in which an investigation by the department must take place. Am I understanding that correctly?
Right. So the charges are brought against the supervisor within 90 days of the alleged offense. And then a hearing is held at a reasonable time after the charges are brought. It's a distinction between that and the patrolman's contract where they have 90 days to bring the charges and then they have to hold a hearing within 60 days.
When you say the charges are brought, who is responsible for bringing the charges?
So again, just so I'm clear, this is not criminal charges. These are disciplinary.
I understand. I'm speaking of a departmental personnel matter. Who is responsible for bringing the charges?
So the police commissioner would issue a charge letter after an investigation by the IIU, and then a hearing would be held in front of the Community Police Hearings Board to determine whether or not the charges are sustained or not.
So when you say the charge letter, that is not when a complaint must be filed. It is 120 days to issue a charge letter by the commissioner.
Yeah, it's 120 days to issue the charge letter. So the complaint comes in, and then an investigation ensues, and then when the investigation is completed, the commissioner issues a charge letter, and then a hearing is scheduled. And at that point, the CPHB would make a determination whether or not the charges were sustained or not, and then the commissioner, if the charges were sustained, would issue discipline.
So what happens if a complaint is brought on day 121 from the incident? What would happen?
So if the department was not aware of that, you would go to the next sentence. In my opinion, you would go to the next sentence in the contract, and that's the sentence that reads, bear with me, in the event the charges are initiated subsequent to 90 days, or 120, as set forth above, the city will have the burden to prove that such delay was caused by circumstances beyond the control of the department, which rendered the initiation of charges impracticable within the time period specified here and above. So it's my position that if the complainant doesn't come forward until day 121 or day 150 or day 180, then that's when the clock's going to start ticking. And we're going to say, we're going to bring charges, and there's going to be a hearing in front of the CPHB, and then the commissioner is going to issue discipline if the charges are sustained. And if the union then files a grievance and said, you know, well, you didn't bring your charges within 120 days, and therefore, you know, you can't bring charges, we're going to defend that by saying, well, we weren't aware of it until 180 days, and that's what triggers that next sentence.
You mentioned that, you know, this language has been in the contract for some time. What's the origin of the language? How did the language end up there in the first place?
So, you know, what I did was I read from an arbitration decision, an interest arbitration decision between the IBPO and the city. And it goes back to 1990. It's the Argrid-Anderson decision. And what I surmised from that, because the IBPO had this language, had the 90 days language, and then charges had to be brought, you know, within a practical amount of time after that. Well, I'm sorry, if the charges weren't brought within that, the burden was on the city to show why it wasn't brought within the 90 days. So because that language existed in the IBPO contract, I am surmising that that language was in the police supervisors at the same time. And then the IBPO proposed an interest arbitration to change that to a straight 90-60. And the arbitration panel bought that, and that's the contract that they adopted. So they went with that straight 90 days, 60 days, and that's how it came out in their contract.
Can you explain to me what an interest arbitration is?
Sure. So in the public sector in Massachusetts, the closure mechanism for police and fire public safety units is interest arbitration. So what happens is typically it's a 3-member panel appointed by the Joint Labor Management Committee. After mediation has been exhausted and after the committee level mediation has been exhausted from the JLMC, there'll be a panel of arbitrators. One will be a neutral, one will be a management rep, and one will be a labor rep, and those reps will be appointed by the Joint Labor Management Committee. Then the city will bring its case, no more than 5 issues, and the union will bring their case, no more than 5 issues. So even though we may have 15 things that we want to change in the contract, we're limited to 5, just as they are. And then the arbitration panel that hears both sides, it can be a few days of hearing, and then they issue what's called an award. And the award is, you know, this is how we rule on each of the issues that were brought by the 2 parties. This is how we rule on wages and duration. And then it's turned back to the city, and the city administration needs to support that in front of the funding body, which is the city council. And then the city council votes on the contract.
Attorney Mahoney, you mentioned that this contract would be good through June 2021. And you're going back to the table in a month to bargain another contract. How long would that contract that you're going back to the table in a month that you're bargaining for, how long would that contract be good for?
So, you know, thanks for asking the question, because it kind of dovetails with Councilor Whitfield's question. When we put our initial proposals on the table back in February of 2020, it was before this COVID hit. So we had a different strategy going to the negotiations prior to COVID than we did once we got into COVID. So as we're coming, hopefully as we are coming out of COVID, we'll hopefully have a different strategy with our negotiations. So we did not want to go long on the contract because there's so much uncertainty in what FY 22, 23, and 24 look like. I'm hoping that there'll be more certainty to those years, you know, for instance, if we get a vaccine in the next few months.
So you don't know how long the next contract that you're bargaining for yet will be for?
I don't know.
Okay.
I don't know.
Now, in the event, I apologize, you know, for the lengthy questions, but it's an important issue. And I, you know, again, I want to thank colleagues. I know we're all, you know, this is a real different medium than we're usually in. And, you know, we're all getting by here on our computers, making sure we can take care of the business of the people in the business of the city. So I just have one last question relative to this issue, because I really want to understand if you go to bargain the next one in a month, how long do you expect that bargaining to take place? How long do you expect to have another contract before us?
I don't have an answer for you on that. I'm sorry.
Okay, if the contract gets voted down, if we vote the contract down tonight and you go back to the table, how long would you expect that arbitration or that negotiation to be for? And would that be for a 1-year contract? And like, how long would that contract be for?
It could be, a lot's going to depend on what the reaction of the labor union wants to do. I mean, if they are upset that they bargained in good faith, they reached a tentative agreement with the city, and the contract got shot down after they ratified it, then they may want to march into the JLMC. I don't know what their strategy will be.
Okay, I'll yield. Thank you, Attorney Mahoney.
Councilor Whitfield.
Thank you, Mr. President. Bill, do you have like an estimate of how many cases went past the 90-day mark?
I'm only aware of one since in my tenure.
One in your tenure?
Yeah.
Okay. One that went past the 90-day mark.
Right.
And
we brought
did you guys fight for that one?
Yeah, we brought charges and the union grieved it, and it's still pending at arbitration.
It's still pending in arbitration?
Yep.
Okay. All right. Because I'm not fighting to be perfect, but I'm also not going to settle. It's not settling time for us anymore. I bet that if we look at the civilian cases, the majority of them will be from minority complaints. And I just can't see settling anymore. We have settled long enough, have been brutally beaten, have been, and that's been covered up. That hasn't been filed, got punched in the face, clotheslined off of motorcycles and bikes, and being perfect and settling, two different things. And I'm not ready to settle. 120 days doesn't do justice to the contract for the civilians. It doesn't do justice. And it's an insult that the union would put that forward as a negotiation tactic. And why? If you're doing the right thing, why not make it a year, 2 years, 3 years? If you're doing the right thing and you have nothing to fear, why not make it more? And I respect Deputy Chief Kent for coming on and staying on for so long and, saying something is better than nothing, but not to me. Because when you take anything, then that sets the precedent. And the precedents should not be set by 120 days. And so I can't, in good faith, good conscience, accept it. It's not settling time for me anymore. And I'm sorry, if negotiations have to take longer, if we have to deal with the 90 days, since it's only been one so far, so be it. So that's where I stand.
Thank you.
I'm not aiming for perfection, but I'm aiming for justice. And we have not had justice for far too long, and it's time for a change. Thank you.
Thank you, Councilor Whitfield. If there are no further questions, Madam Clerk, can we please call the roll on this order, which requires a roll call majority vote for passage?
On item number 24, Councilor Gomez.
No.
No. Councilor Whitfield.
No.
No. Councilor Davila.
No.
No. Councilor Fenton.
Yes.
Yes. Councilor Curran.
Yes.
Yes. Councilor Ramos.
No.
No. Councilor Wall. Absent. Councilor Williams.
No.
No. Councilor Allen.
Yes.
Yes. Councilor Letterman.
No.
No. Councilor Edwards.
Yes.
Councilor Brown.
No.
No. Councilor Hirsch.
No, the contract does not pass. Madam Clerk, is there any other item before the City Council this evening?
There is, but it's not moving forward.
Thank you. If there's no further business before the council, we stand adjourned until our next regular meeting on Monday, the 23rd. At our hearings meeting Monday, the 23rd at 6:30. Have a
Mr.
great
President.
evening. Yes.
I'd just like to remind the council, my fellow colleagues, there is a hearing tomorrow at 11 regarding water quality, the state and federal government hearing at 11 on Zoom. If you haven't had enough Zoom,
Hey.
at 11 o'clock, we can have another meeting.
Thank you, Councilor Curran. Thank you, councilors. You guys have a wonderful evening.